Of 10 o'clock having arrived, I call the meeting of February 23rd to order. And I, pursuant to the Illinois Attorney General's guidance to public bodies on the Open Meetings Act during the COVID-19 pandemic, dated July 2nd, 2020, county board members may participate without being physically present in compliance with the established provisions. I am advised that there is not a quorum here. Is that correct, Mr. State's Attorney? So a physical quorum of the members is not present. However, pursuant to Section 7E of the Open Meetings Act, members are permitted to attend remotely. Either one member of the committee, the chief administrative officer, or our own chief legal counsel are physically present at the regular meeting location. In-person attendance and public comments are allowed, subject to attendance limitations required to ensure the health and safety of those who attend. So with that, I will ask Member Greg Hart, would you lead us in the Pledge of Allegiance? Please remain standing as I invite Rabbi Ricky Kamel from the congregation Itzak Kayam in Lombard to lead us in invocation. Rabbi?
We come together today to serve the needs of the people of our county, to listen to what those needs are and be partners in helping bring all of our citizens, no matter their background, up. We know this is a difficult challenge, so we ask for compassion to find the right way, wisdom to find the best way, and vision to find the most sustainable way. We ask that we can all come together and make this great county of DuPage even greater. There is a blessing that we say when we engage in public work. Baruch atah Adonai Eloheinu melech haolam, asher kiddushanu b'mitzvotav v'tzivanu la'asok b'tzochrei tzibur. Blessed are you, the Lord our God, ruler of the universe, which has given us the commandments and commanded us to delve into the needs of the community. In this way, we ask to help make a more perfect world, to which we say, Amen.
Amen. Thank you, Rabbi. Mr. Deputy Clerk, would you please call the roll?
Chaplin.
Here.
Chavez.
Here.
Covert.
Here.
Desart.
Here.
DeCiani. Eckhoff. Garcia.
Here.
Hart. Krajewski.
Here.
LaPlante.
Here.
Ozog.
Here.
Pachowski. Renahan.
Here.
Rutledge.
Here.
Schwarzy.
Here.
Selman.
Here.
Tornatori.
Here.
And Zay.
Okay. Thank you, Mr. Deputy Clerk. We move on to the next order of business entitled Chairman's Report. And we've got a couple presentations. I know Karen Ayala is here, but first we'd like to honor citizen advocates in a proclamation. I know there's a few folks here. I was thinking maybe we should keep everyone there. And then Julie, maybe you, I mean, if that's what you like, just in the interest of health and safety, instead of everybody parading in here, but whatever you would like, it's up to you. Okay, all right, there we go. Mr. Briggs, open up the floodgates. Yeah, right. There we go. Say, Julie, why don't you join your friends and neighbors up at the podium. Today we have the opportunity to honor several local citizen advocates who were part of the large and effective community effort to shut down the Sterigenics facility in Willowbrook back in August of 2018 when we first learned The Sterigenics plant was emitting ethylene oxide into our air, threatening the health of our residents. These folks all sprung into action. District 3 member Julie Renahan asked for this recognition today. We have with us Catherine Camarina, Shri Rao, Tom Klistek, Ursula Tenoya, I hope I pronounced that right, forgive me if I didn't, Margie Donnell, and Melissa Alvarado, who are here in person. And so I have a proclamation, and I can read it here. Where's Member Renahan? Oh, there she is. Okay, so we'll do it.
Right then.
Forgive me. There we go. Proclamation honoring citizen advocates in Willowbrook. Whereas DuPage County Board Chairman Dan Cronin, the County Board, Member Renahan, the DuPage Health Department became aware of unsafe levels of the chemical ethylene oxide being emitted from the Sterigenics Willowbrook facility beginning in August of 2018, and they immediately acted. And whereas Chairman Cronin and District 3 board members joined local mayors and called on the company to cease operations, citing research from the U.S. EPA indicating that ethylene oxide is far more dangerous to the public than previously known. And whereas, on behalf of the county, Chairman Cronin, District 3 County Board members joined Senator Curran in a request to the Illinois Attorney General and the Illinois Environmental Protection Agency, IEPA, to take immediate action revoking the operating permit for Sterigenics until further health and environmental studies on the safety of the air near the facility could be completed. And whereas in partnership with the IEPA, the DuPage County Health Department conducted ethylene oxide and ethylene glycol testing of the resident well water supply near the Sterigenics facility. And whereas the DuPage County Board joined with community activists, neighbors, business owners, and residents in calling for a permanent shutdown of the Sterigenics facility in Willowbrook to reduce the danger of exposure to ethylene oxide to the families living in and around the plant. And whereas through months of hearings, testimony, meetings, residents formed community groups, Stop Sterigenics, ETO, Research and Response, joining with Willowbrook Mayor Frank Trilla, board members, legislators, other elected officials to educate the public, state, federal lawmakers about the tragic impact exposure to ethylene oxide had on the residents living near the Sterigenics plant. And whereas, while painful and difficult, families who lost loved ones shared their stories of loss due to cancer and other prolonged illnesses following exposure to ethylene oxide, illustrating the devastating impact to the DuPage community and similar communities around the nation. And whereas these grassroots community efforts undertaken by individual citizens were pivotal in moving public opinion and spurring legislation that ultimately convinced Sterigenics to cease operations in Willowbrook in September of 2019 and to withdraw permit applications from the IEPA in July of 2020. Member Hart, why don't you come on up here and join us too? Anyone else here from District 3? Now therefore be it resolved that I, Daniel J. Cronin, Chairman of the Board, members of the DuPage County Board, hereby express gratitude and honor citizen advocates whose tireless work supported state and federal efforts to ensure the air we breathe is clean, protect the health of all Illinois residents, resulting in the withdrawal of Sterigenics from our community, making Willowbrook and surrounding communities safer for DuPage County families. I'll entertain a motion. Seconded. All those in favor say aye. Opposed, nay. The ayes have it. Enacted this day, 23rd day of February 2021 in Wheaton, Illinois. Thank you very much. Hey, congratulations for all your advocacy. Thank you. Who would you like to offer some remarks? Ursula, please. Ursula, famous name, made famous by Harry Potter.
As usual, I am going to be presenting a statement, but it is a collective effort, so we all contributed to this statement.
Breathe.
Stop Sterigenics was created in an instant, responding to a public health crisis. Outrage at the news that Sterigenics had silently poisoned us for over 30 years brought us together, those here today, virtually, and more. Within weeks, we organically built an organization of over 8,000 affected neighbors from different backgrounds, different socioeconomic groups, and vastly different political views. Operating 24 hours a day, 7 days a week, groups, subgroups, and individuals worked tirelessly against the public health threat of ethylene oxide emissions in our community. Today, we are gathered here and virtually to recognize the achievements of our citizens and our elected officials working together. We are so proud to represent all of those volunteers and contributors today who played a role in this success for our community. Success depends on a common mission. Facts, the real facts about science, the process, and regulations were vital to our credibility. We needed to convince our representatives and career officials in all levels of government, from village to federal, to look beyond politics, past decades of propaganda, and focus on public health. Together, we rejected the alternative facts Sterigenics spouted to limit regulation and increase profits. Together, we saw the fact that our families, friends, and neighbors were getting sick and dying because of the false narratives woven by an industry built on profits at the expense of people. What we all did, acting together on facts and focused on public health, serving and protecting people, first and foremost. That's what good government is all about. Your swift actions and bipartisan support were a great example of how an elected body should operate. We cannot thank you enough. Your support and the support of our state representatives, especially State Senator John Curran, Governor Pritzker, U.S. Congressmen and senators, local village authorities, and organizations like IEC, the Illinois Environmental Council, were critical to the final outcome. Strong fact-based reporting by our local media helped keep the public informed and engaged. It was this coalition that created the momentum to complete our community mission. Sterigenics is closed. We've reflected on what happened between August 22nd, 2018 and September 30th, 2019. It was remarkable. It was unprecedented. It was surreal. The planets were definitely aligned. We have an incredible success story here in DuPage, but we have more work to do. Millions of people around the country and globe are still exposed to ethylene oxide and other pollutants. We know the pollution and its effects travel around the globe, affecting us all. We want to recognize other communities fighting this battle against ethylene oxide emissions in Georgia, in Lake County, and in New Mexico, where lawsuits are now filed. We will continue to have avoidable illnesses and avoidable deaths until the U.S. EPA makes significant changes in policy to better control ethylene oxide and other carcinogens to protect public health over corporate profits. Thank you for this opportunity to highlight a success story of a community and government working together to find solutions. Let's continue to work together to create a better, safer, and healthier future. Thank you.
Thank you very much. Okay, the next item on our Chairman's report is a COVID-19 vaccine update. Karen Ayala is here. I think I saw Chris Hoff is here as well. I do believe, and I think you all would agree, that this is the most important issue before us at this time. The need to vaccinate our residents to keep them safe from COVID-19. it's fair to say I haven't been shy about expressing my real concern about the alarmingly low allocation of first doses of COVID-19 vaccine that DuPage County is set to receive this week and next. These allocations are set by the Illinois Department of Public Health. It just has been really very difficult for us every step of the way, and I think one of the most difficult things about it has been this sort of unprecedented approach to this matter by IDPH. Historically, traditionally, if you look at the law and administrative rules, the local health departments are where the initiative is to be taken. Historically, traditionally, the body of law, administrative rule contemplates that. And here we have IDPH trying to lead and tell local health departments what to do, and we have difficulty with that because of a level of competence. We are being charged with allocations, and on IDPH website they say that we are getting X number of allocations, and in that number are allocations that are going to healthcare providers in other counties. They don't even know where Rush Copley Hospital is located. So it's very disturbing, it's very troubling. I have tried very hard to work together. This isn't about conflict. This isn't about anything personal. It's certainly not about politics. This is about being a zealous advocate for the citizens of DuPage County, and it has been extremely difficult. After many days of intensive and sometimes quite animated conversation with the governor, his staff, and IDPH, I can report to you that our vaccination allocation has gone up incrementally. We're getting 2,000 more vaccines for this week, moving the allocation from 2,450 to 4,510, roughly 2,000 more allocations. Now keep in mind, this is for a county of nearly 1 million people. Completely and totally inadequate. Next week, our allocation went from the original 5,000 to 6,200. So for the folks that may be listening in the governor's office, thank you very much. We appreciate it. Every little bit helps. And for the week of March 8, our allocation is now set at 12,290. So it does appear that this is a particularly difficult stretch. We don't know why. There's not a lot of disclosure. There's not a lot of transparency. We don't really know why. It doesn't all add up where all the vaccines are going. However, we do acknowledge that there is a terrible shortage of supply nationwide. And I think the governor and his office and IDPH, they're all trying hard. Everybody's trying their best. So I have to make sure that I emphatically state that, because that is exactly the truth. So I believe the governor and IDPH have a better understanding of our abilities and our position here in DuPage County. I'm fulfilling my job, my responsibility to be a zealous advocate and try every step of the way to make sure they understand what our experience is here. Right now we have hospital systems, leadership of the private sector, healthcare partners that are rather alarmed. And so we're trying to set up something where they could communicate with the leadership of IDPH and try to understand what is going on. I know that one of the major objectives is equity. Equity in vaccination has been our vision and our goal, and that's our imperative from day one. And we've created with our healthcare partners a very efficient and effective network that will do just that. We'll make sure that this vaccine is distributed equitably. But the fact remains, we simply want and need more vaccine to fulfill our mission, safeguarding the health of DuPage residents. So, Karen, I hope I didn't. I hope I haven't left anything out. On the other hand, I want to make sure that you're the expert here, and so I'm just here to support you and thank you for all the good work you do. I'll turn it over to Karen Ayala.
Thanks so much, Chairman, and thank you for this opportunity to provide you with a vaccine update. I want to make sure that you all know that this too, similar to the Sterigenics response, this is not a response of one or two people. However, there have been several people who have been instrumental in mounting the public health response necessary to address this pandemic. And one of the individuals who will have his name amongst others in DuPage County history is with me today, Chris Hoff, who has served as our incident commander. So I just want to tell you how much and how very fortunate we are in DuPage to have the depth of leadership and competence at our public health department. With me also virtually are Dr. Chug and Adam Forker, and together with Kristen Lundeen, we have formed really the nucleus of developing our vaccine response. That it encompasses thousands of other people across our community. I saw the presentation and then it went away. So let's start with a quick reminder. There we go. Of our vaccine goals. We have set the goal of 80% of the DuPage population over the age of 18, which is 572,000 to receive the life-saving gift of the COVID-19 vaccine. We have made tremendous progress. And I think on the day that we marked, or after we marked as a country, 500,000 lives lost as a result of COVID, it is equally impressive on the positive side that almost 16% of the population in DuPage County over the age of 18 have received at least one dose of vaccine. Additionally, based on the data that we've been able to analyze so far, approximately 42% of first dose recipients are over the age of 65. So we are reaching the individuals with the highest level of risk. Next slide, please. So some key messages, and we've been developing these over the past couple of weeks. We offer them to you and to you then to be able to amplify these messages across your communities. Again, a reminder, almost 300,000 people are currently eligible in the 1B priority group. And this week, as the chairman mentioned, we received 4,510 first doses. We're projecting a slight increase, but our average supply over the last 4 weeks has been about 7,300 first doses. This last week, we had 53 providers ready to go who would have been able to use 53,000 doses had we had them available. We are focused on assuring broad access to all eligible 1B, the current 1B population, prior to expanding into the 1B Part 2 or 1B plus population, until either our demand for the vaccine decreases, our supply increases, or we're able to attest that a significant proportion of the current group is vaccinated. The 1B Part 2 or the 1B plus expansion population represents another 174,000 individuals. So adding 174,000 to the already undersupplied population does not make a lot of sense, since these priority groups were identified based on risk in the first place. So this extreme mismatch in our capability versus our allocation is not something we have control over. We've tried to influence and build our allocation and would welcome your help and support. What we need most is to build people's confidence that the system, once we get the vaccine, is working. And DuPage leads the metro Chicagoland area in the population fully immunized. It will take time to vaccinate everybody, but we will get to everyone who wants a vaccine. So the next slide shows the breakdown from the IDPH website. On a daily basis, this is updated around noon. You will see that in the chart on the right side of this graph, you will see that we had a very steep increase in our ability to reach out and administer doses, which has over the last couple of weeks, or days, I should say, dropped a bit. And that drop is not due to a lack of ability to vaccinate. Again, it is tied directly to the amount of vaccine that we have been allocated. We have nearly 44,000 people now who have received 2 doses and are considered to be fully immunized, which represents 4.78% of our population. I think it's really important to celebrate for the moment our progress, but to also realize that these next couple weeks, because of a 2,450 dose allocation last week, a 4,000 dose allocation this week, and looking for a 6,000 dose allocation next week, our efforts will plateau. The next slide shows is a snapshot. We pull off the metro counties, and you can look at that again on a daily basis. The following slide, really small numbers for PowerPoint presentation, but what we've done because of the work and the investment from Dr. Chug and her team, working with the people holding this data at IDPH, have been able to identify a little bit more about who has received vaccine in DuPage County. Now, these are not people who we have vaccinated necessarily. These are residents of DuPage who have received vaccines. So you will see, again, we still have in the first dose, when it comes to race and ethnicity, we have large unknown or not provided categories. You will see, however, that the reflection for the first dose, the 42.2%, going to 65 years old and older. And you will see the ongoing disparity between females over males receiving the vaccine, pretty much 2 to 1. Next slide. Just a quick reminder of our timeline. Based on vaccine supply, again, we anticipate it may take up to 12 weeks through the month of April to fully vaccinate 270,000 people eligible. We are starting in the 5th week, and unfortunately, we have received an average of 8,600 first doses each of those weeks. Our 12-week prediction was based on receiving 18,000 doses a week. We do anticipate that these are the dark days of vaccine supply, right? So we have every reason to believe that the vaccine supply is going to increase, and at least one new vaccine may be approved for use by the FDA soon. But again, when we look at the next slide and see that our rate or our allocation for vaccine has gone down the past 5 weeks, it is a little disheartening. The following slide shows a breakdown of first doses and second doses that we received per week. This is very, very important, and we have been using this to stress the need for additional first doses in our community. We have robust healthcare systems with lots of capacity, not only for dealing with ill individuals within their systems, but for managing this vaccine. And so when we're offered an ability to order that second dose vaccine, we take it and our sites can store it until it's ready for the person, either after 21 days or 28 days, to receive that vaccine. And we've done so because the supply chain has been so erratic, and because both of manufacturing delays as well as weather delays, right? So it's been some man-made and some nature-made kinds of challenges. But those swings can influence a large swath of people, whether they're receiving their second dose of vaccine or not. The next slide shows that we now have 111 approved provider sites. Not all sites, in fact, very few of these sites these last couple weeks, are receiving the vaccine because supply is so low. And yet these providers report being able to and having invested resources to administer at least 50,000 doses per week. So we are ready for increases in supply. You see the reports of the Illinois National Guard being deployed to Winnebago and to additional Cook County sites. And it's very deceiving because it appears or it implies that those sites are going to be getting additional doses of vaccine. But it's important to understand that whereas the Illinois National Guard provides support for the distribution, the doses that they administer come from the county's allocation. They don't bring additional allocation. So one of our strategies has been to make sure that we have these providers, these vaccine providers, geographically distributed throughout the county. This model, this decentralized model also promotes equity by ensuring vaccine is available through traditional medical providers and areas, including pharmacies throughout the county. What you see is a screen grab of a newly added piece of information from our interactive dashboard that shows where vaccine is being distributed within DuPage County. This is not live yet, but it will be by the end of tomorrow. The map shows all providers who have registered and will show vaccine allocation as providers receive vaccine. It's important to note, you see that one outlying dot over, that's in Oak Park, is a provider who has received vaccine from us because they have agreed to provide on-site vaccinations at residential group homes for individuals with disabilities. We'll be then updating this data each week to share more information about where vaccine is being distributed and available. Next slide. Again, we're still in our 1 week allocation from the federal government. Again, we do have 3 weeks look ahead as kind of the basis for our planning. We'll be much more grateful for that 3-week look ahead when it actually shows that our numbers are going up. One of the ways, and this is on the next slide, that we have been allocating and determining where we send vaccine that comes to us is by using the Social Vulnerability Index. The darker spots of the county reflect higher levels of vulnerability. And we're working with pharmacy partners and health systems to direct their vaccine efforts, albeit limited at this point, to these underserved areas. Other considerations are listed on the next slide to make sure that clinics are open to all community members. Whether or not a facility has greater than 50% of individuals to be vaccinated will be coming from an area in the top 10 census tracts based on the Social Vulnerability Index. and making sure that clinics are open to Medicaid and uninsured residents. We've also, and you'll see on the next slide, just a reminder about our Health Equity and Access Response Team, or HEART. We continue to work with this team to ensure equitable approach to the COVID-19 response, and now are focused on vaccine access. The next meeting is Friday, and we'd appreciate your sharing this information with any community groups that you may be working with that represent multilingual communities of color, particularly Black, Latinx, Asian, Islamic, and other racial, ethnic, faith, and minority groups. So with that, I'd be happy to entertain questions.
Okay, we have a few questions. Member Eckhoff, followed by Member Rutledge.
Oh, we can't hear Member Eckhoff.
Okay. Thank you for all your hard work, and I'm sorry to you and Chris that I keep sending you emails that probably take away from your other work, but just a couple questions. Number one is, when somebody applies through the DuPage County Health Department, is it just first come, first serve in that group, or is there somebody taking a look at the pre-existing conditions of somebody and then reshuffling the deck every day?
Yeah, so we have about 250,000 individuals who have registered on our website. So we take those individuals, if they're eligible, by category, and then by the date and time that they registered. So there is not the individual level of scrutiny of those people on the list.
And then, if you apply more than once, does that somehow affect your availability to get a shot? Or?
It probably does not, but I know it's something that helps people feel like they for sure are on the list.
Keep on hitting the enter.
Yes. The most important thing is that we send out a reminder. We send out weekly updates to everybody on that list, email updates to everybody on that list. So if people are on that list and say they have not been receiving those weekly updates, first I would ask them to look at their junk and spam mailbox, because again, this information is getting pushed out in mass, and we found many people who thought they weren't getting it and it was going to their junk folder. If they check that and it's not there, then please let us know and we'll confirm individually that they still are on the list.
And then my only other question was, I thought I had read in the paper somewhere that a school district had gotten a supply of vaccine and was administering that, and I didn't know if that's one of the providers that you're working with, or somehow they came up with their own dosages.
So schools are part of the 1B allocation. The priority groups, educators, daycares, are part of the 1B priority group. They are not vaccine providers themselves. They have worked to partner with vaccine providers.
All right, thank you.
Okay, we have Member Rutledge, followed by Member Pachowski, followed by Member Ozog, followed by Member Zay.
Thank you, Chairman. And thank you, Karen, for coming to speak with us this morning. I have two questions for you this morning. The first one I believe I have raised prior, but you showed the map of vaccination sites within the county, said it was countywide, but there are none of them in District 6. So I'm definitely advocating for us to expand into those districts.
Absolutely.
The other question I had is, one of your stats, it showed the percentage of people in DuPage County that received vaccines and out of DuPage County that received vaccines, and it was pretty equal. Did I not see that right, or could you?
No, that's absolutely accurate. So remember, we're vaccinating people who live or work in DuPage County. And what we haven't had heretofore is a glimpse in how many people from out of county are we getting, right? And it is very close to half and half. So the good news is that that must mean that half of our residents are getting vaccinated outside of our county to make up that whole. So, and at this point, That's about as much of a window as we have.
But you have no statistics of how many DuPage County residents are being vaccinated in other counties?
Correct.
Okay, thank you, Karen.
Yep.
Thank you for your hard work.
Thanks. Thank
Okay,
you.
we have member Pachowski, followed by Ozog, followed by Zay, followed by LaPlante. She's used that little hand there. I like that. Thank you. Member Pachowski.
Thank you, Mr. Chairman. We spent CARES Act money specifically for Bensonville and Addison regarding the Hispanic community for COVID-19. Are we seeing anything of showing that we're getting some bang for our buck in getting people out in those two areas? And is that 1.9% something that was to be expected, or is it relatively low or higher? No.
So the 1.9% that you're talking about is from where?
I thought the Hispanics getting vaccinated was 1.9%.
Okay, yeah.
My question was, is Addison and Bensonville, who had CARES Act money spent specifically for dealing with Hispanics with COVID, are we seeing anything different in those two communities? And can you break it down by communities?
So not yet.
Okay.
However, we have been able to work with those communities to when there are opportunities. So I've talked a lot about the allocations that come to us. There are other allocations like that come to the pharmacies or come to other providers in the community. And we've been able to reach out to those communities that have been, like Addison and Bensonville, and then encourage them. Now, I don't have data to support what that has resulted in yet. But we do feel like that in those communities that have been working with their vulnerable residents, that we're building trust so that when the vaccine is available, they will avail themselves of that vaccine.
Are we going to do something? I thought 1% was exceptionally low, and I'm not an expert. Maybe it is or it isn't. But it seems to me, should we be doing something in addition to get the 1.9%? Should it be 5%? Should it be what non-Hispanics are?
Right. Well, yeah, ideally it would be the percentage that is, demographically consistent with where we're at. The challenge with that 1.9 is that I think it's like 74% is not reflected at all. And so once we develop tools to better track that information, I think we'll have a much clearer, because 1.9 is very, very low.
All right, thank you, Karen.
Mm-hmm.
Okay, member Ozog.
First of all, Karen, thank you so much for all the work you and your staff are doing. We're heading into a year anniversary and can't thank you enough. But I have two questions that I'm confused about. So in terms of your statistics, and again, question is to support you guys. Mm-hmm. My husband has been contacted by Northwestern Medical, and he signs up and he got an appointment in Woodstock this week. So are you saying that he, as a DuPage resident, is not going to be counted in your numbers? Or that's not being reported back to you? Or is Northwestern Medicine reporting back to you?
So Northwestern Medicine will report their vaccines into the state registry, which is iCare. Okay. And then that vaccination will be reflected in our numbers.
Oh, okay. So it will be counted. Mm-hmm. So
yes,
as a DuPage resident. Okay. Question number one. Question number two. Is this an allocation issue that the state is not allocating directly to county health departments? They seem to be allocating to you, but then they're also allocating to other providers, for instance, Walgreens, CVS, et cetera. So is it sort of a dual distribution system that's going on here?
At best, I would say it's dual. I think there's probably even more layers because of the different programs through the pharmacy sector in particular. But yes, it seems to be coming, and without a doubt, we know that vaccine supply is very, very low right now. We're not at all denying that fact. We're just asking for a little bit more clarity and transparency on the vaccine that is coming into Illinois, that is allocated for local health departments to then be distributed to be more open and, like I said, so that we can better understand it.
So,
But at this point, though, it is positive. It is something positive that people can do. For instance, this morning I was checking on Walgreens, and there was availability if you fit a definitely more narrow criteria throughout the region. So I have been alerted to that through Facebook. So if somebody has registered with you, they can still attempt, if they're eligible, obviously, to go ahead through Walgreens or CVS.
Oh,
and
absolutely.
There's really sort of several options opened here to try to get an appointment. Okay,
Yes,
thank you.
Yes, there's us, there's the pharmacies, and there's primary care providers, and we would absolutely encourage people to get on every one of those lists.
Do you give your names to the primary care providers Northwest in our area, Northwestern and DuPage Medical?
When when vaccines is available and they can do those clinics, yes, we absolutely do.
But are you referring patients? People who've signed up with you, I think you said 240,000. Are they referred? Do you take those names and give them to the healthcare providers? Or are they going through their own patient list?
They're going through their own list at this point.
Okay. All right. Thank you. And thanks again for your hard work. Really appreciate it.
Okay, Member Jim Zay.
Thank you, Mr. Chairman. You know, Karen, you're always very positive, and this is the first time in all your presentations I've heard some downness in you, and I think we've heard it from the chairman. But we shouldn't be surprised that the IDPH and the state is not giving us our fair share. We went through this with PPE, with testing, with everything else. But this board at the time took that matter in our own hand. We spent $17 million out of CARES Act. We set up our own testing facilities. We worked to get our own PPE. We did it on our own. Unfortunately, for vaccines, we can't do that, and I hear your frustration. My frustration is, this hasn't been, I know we talked about in bad weather and everything else, but your graph showed this continually going down to DuPage County. Well, if anybody who watches the news continues to see in Cook County and the city of Chicago, continuing more clinics opening and more people getting vaccinated. But is that at the expense of DuPage County residents? I mean, again, we're the second largest county in the state. I mean, this isn't political, this is whatever. This is the lives of our residents. I know every board member every day is getting frantic text messages, phone calls, emails. Where do I go? Where do I take my 87-year-old mother who I can't get in? And I've tried to do everything else. When are we going to see some transparency from IDPH? Because again, I have a feeling that our part of our allocation, the city of Chicago is getting a direct allocation from the federal government, if I'm not mistaken. But how do they continue when they get into a labor conflict with CPS? All of a sudden now they can allocate 1,500 vaccinations a week for their teachers, which is almost equal to what we're getting for our entire county of 1 million people. But again, I would hope, we've come together as a board before. I hope we can now come together as a group and say to IDPH and the governor, and back our chairman up and say, we know this is difficult, but we do not think we're getting our fair share here. And again, we should be getting more. I mean, your chart says we can almost do 60,000 people a week, and we're doing 2,400. We're not even doing first vaccinations right now for our first shots because we have to save it for the second shots.
Right.
This isn't right, Karen. You know it, and I know it, and I think everybody else knows it here. But chairman can't be alone. This board needs to stand up and say something, because it's not political. It's about the lives of our residents and our seniors and everybody else. I mean, I'm a manufacturer. Our company has been off 3 days since last March because we were deemed essential. We make parts for food service, for military, for air, you name it. We've been there. I registered our people. But I see teachers that have been teaching Zoom for the last year, getting in line in special groups, I don't know what you call them, special groups getting 5,000 vaccines, 2,500 vaccines. And getting more than, again, what we're getting in 2 weeks, these special groups are getting them, and I assume they're being distributed by IDPH. I mean, how do we get something together here? You know, so, again, the chairman did a great job of doing it, but we got 2,000 extra. I mean, that's something, I guess. It's better than nothing, but nothing is pretty close at that point.
Well, yeah, and I wish I had an answer other than we have yet to be phenomenally successful with our interventions. However, I think a lot of times persistence is more important, and so we will continue and persist in using data to support the need for our residents.
If I may, the reason why I'm so animated on this, and I think all of you would expect it of me, and this is, I'm speaking on behalf of all the county board members, is that it's been so painful. It's been so difficult. And I don't think it's a goal. I don't think it's an objective that we get back to normal and our kids get back to school. I think that's an imperative. And if you look at the rate of vaccinations, mathematically, it's impossible for us to vaccinate 80% of 930,000 people out here before next fall. That's alarming to me. That's alarming to me. And the thing that's most troubling about all of this is the lack of transparency. So what happens when why can't we know exactly how many doses are coming into the state of Illinois and exactly how many are going to this provider or that provider, this region or that region? Why is it so opaque? Why are they holding the cards back like this? It's very, very troubling to me. And what happens as a result of that is that it feeds this distrust. I don't know if you have all heard it. I would expect you have by now, but most people have approached me and said this is like the Hunger Games. You know, it's each man for himself, each person fighting for their special interest. And you know what? This system, this lack of transparency, that fuels that, this distrust. They assign allocations to us, thousands more than we actually have. So I get really nasty emails, same emails that you get, like we're sitting on vaccines and we're not doing our job. Those are fighting words because we couldn't do our job any better than we're doing it now. Every vaccine that we get gets out and into an arm in short order, and we do it well. They don't delineate between first doses and second doses. So it's misleading, the information. They assign providers, healthcare providers that aren't even located in our county, and they're saying that that's part of our allocation. It's insanity. And I've been banging this drum. I've been repeatedly making this point. I've asked for meetings. They've been accommodating. We talk, we listen, we talk, we listen. Nothing changes. And so we were told by the director of IDPH yesterday that there's going to be huge supplies of vaccine coming soon. I think she used some sort of metaphor. It'll be falling from the sky. There'll be so much of it. Okay, how much? When? How is that going to be distributed? How do we prepare for that? I was talking to our CEO from DuPage Medical Group. They hired 60 new employees to help distribute this vaccine. They're sitting around. They're going to have to shut down their operation. They don't have vaccine for next week. They're going to have to shut down. Our private providers are going to have to shut down. Now, this isn't manufactured crises. This is real. If we just had better understanding of how many vaccines are coming in and where they're going, I think that would go a long way to gaining some trust and confidence in the system. Member LaPlante, forgive me for interrupting. I'm sorry. Go ahead, Member LaPlante.
Thank you, Chairman, and I do understand and share the same frustration. Thank you so much, Karen, for being here today. I also wanted to give a real specific shout out to the HEART task force that I've been a part of. I really am so appreciative of that effort at equality and equity in the distribution of vaccines. That's something, as a lot of my colleagues have already stated, we are getting, of course you can imagine, emails, texts, phone calls every day. And we're in the same boat. We would like, my family would like to be vaccinated. Mm-hmm. What I would like to ask of you are two things. One, can you please address and just speak to the citizens of DuPage County about the reason that we have this lineup, why we have these categories of 1A, 1B, this vaccination schedule. And what I'd like to do is to ask people how hard it is. I understand it's very, very difficult to be patient when you're anxious about getting a vaccine, but that's set up for a reason, to protect the most vulnerable among us. And that's sort of part of the social contract that I think we all need to agree to adhere to. So to address that issue of, I don't know what else to call it, but line jumping. Chairman Cronin called it the Hunger Games approach. That's what a lot of people are talking about. So can you please address that? And then my second is, in terms of building vaccine confidence, like you talked about, like we discuss a lot in the HEART task force, we're all here to help. Every one of my colleagues, we're all here to help. Maybe action items that we can easily take from you and your department to our constituents that can get the message out as succinctly and clearly as possible in order to combat this, again, as Chairman Cronin said, this feelings of mistrust. So that would be really helpful, because I know we're all anxious to help our constituents. And to very much just specifically address, this is a supply issue. And I think if we can get that point made much more clearly, that can help people understand. Thank you very much.
Sure. Thank you. Yeah, and I could go into a little more detail, but I think you nailed it with the reason for the prioritization vaccine schedule, right? So when there is more limited supply than there is demand for a vaccine, then the federal government through CDC and ACIP historically has come up with priority groups of individuals who are disproportionately impacted and or are critical for the operations of society and cannot reduce their risk because of those efforts. And so we still have people on our list who are considered the 1A category. We still are working through the caregivers and the healthcare members of our population. We still are reaching out to individuals who live in congregate settings, whether that be elderly or disabled individuals in our community. And yet when we send out these notices saying, you know, if you're a member of the 1A priority group, please sign up, people in the 1B group think, oh, that's just a misprint. They meant 1B priority group, so I'm going to go ahead and sign up. And not only will I sign up, but I'll forward this link to all my family so that they can sign up as well. And so essentially what we're doing is taking away from the people who are the most at risk. And so again, I would offer just a plea for we're very careful when we send out information about who's eligible and who we're trying to get into our clinics. So I promise you, we will not make an error between 1A and 1B when we send out that link. If we say 1A, that's exactly who we're still trying to reach. So thank you for that opportunity. And increasingly, we will be, as the supply opens up, we will be coming back to you and asking for your assistance in getting the message out around vaccine confidence and the need for people to, it'll probably be when this vaccine is raining on us, that's when we'll have the opportunity, unfortunately, to be addressing that issue.
Member Chaplin, followed by Member Chavez, followed by Member Ozog.
Thank you, Chairman. Please. Thank you, Karen. Thanks for the presentation. I really appreciate it. I think it was very helpful, helpful for our residents that are watching as well. I had a constituent ask me about her mother goes 3 days a week for dialysis. And she said these dialysis centers are great. They could eventually be set up for vaccination sites. And she was asking me about that. But how does a doctor's office or someone or a medical facility register to be a vaccination?
Sure. So if they go into the IDPH website, there is a link for individuals who are or organizations who are interested in becoming vaccine providers.
Okay.
And again, if they're located in DuPage, if they could reach out to us at the same time they're sending their information to IDPH, we can help shepherd that through.
Great. I'll send that on to you then. And then my next question was, could we put that chart up again that has the county distributions? That I think there was a chart that showed how much each county was getting of how many people have been vaccinated.
Sure.
I just want to take a look at that again, because I know that Cook County, I see on social media, like, people in Cook County saying, oh my gosh, we're not getting any vaccinations. We hear DuPage Night's getting any vaccinations. I have a friend that went out to Mendota, Illinois to get a vaccination. So these, from my understanding, is a site in Cook County is not prevented from vaccinating a DuPage County resident, just like a DuPage County site is not prevented from vaccinating a Cook County resident. Is that correct?
Correct.
Okay, so
it's like slide number 6.
So we do have people across the county lines,
states,
and to get the vaccination. And okay, no, it wasn't. It was a different chart. It was not that one.
That one?
That's one. That looks like it.
No, there was maybe it was that one. Okay, yeah, if you go back. Yeah, so if you're looking at populations and amounts of those vaccinated, I don't know if it looks, is there really a huge disparity? Because, like I said, we have people going across to Cook County to get vaccinations. We have people from Cook County coming here. We have people going out to Winnebago. So, I really think more than people maybe not, I don't know, maybe they're not being transparent, but I think there truly is a supply issue. It's not people deliberately trying to say we want to hurt the people in DuPage County, we don't want to give them vaccinations. I think it's a supply issue.
I think without a doubt there is a supply issue, and there is an element of our population who are able to invest in, loading up grandma or mom and dad and taking them wherever they need. I think the ones that we're most concerned about are the individuals who don't have that capacity. And those are the ones who I feel like we in public health and as a governing body need to speak for and advocate on behalf. Because without a doubt, people with we heard early days, people flooding Florida to get there, to travel there to get vaccinated. So without a doubt, there is a supply issue. However, in the collar counties, when we talk with our peers, no one is getting adequate, even what they consider adequate supply with the supply issue, because we're being told that we're stockpiling our vaccine based on the second dose allocation, and that is the essence of frustration.
Yeah. Well, thank you so much. I really appreciate and all your efforts, everybody, Chris, all the hard work you're doing, Dennis, everybody over there. I'm sure it's very stressful. So
yes,
thank you so much.
Member Chavez, followed by Member Ozog, followed by Member Schwarzy.
Thank you, Mr. Chairman.
Member Krajewski, right? You got to use that little hand icon. I don't know how to use that. I like to see that your hand. Please proceed. I'm sorry.
Okay, thank you, Mr. Chairman. I just want to acknowledge that you are in an impossible situation logistically. And my concern is that when you're receiving probably 10% of the amount of doses that you had hoped for and anticipated, that when we look at these 119 vaccination sites, are we feeling like there's a waste of resources and a waste of potentially county funds because we're staffing to certain levels in a hopeful nature? Do we need to pull back a little and get a little more realistic with what's happening? Can you talk me through a little bit of that?
I wish I could. I think it's a great question. And again, if I had a little bit more visibility into when we say that there's going to be vaccine raining on us, what does that mean? Does that mean we're going to get 50,000 doses a week? Does that mean we're going to get 150,000 doses a week? Or does that mean we're going to be back to our 12 to 14,000 doses a week? We need that information in order to determine. Because the other thing what we're looking at is, do we need the National Guard to come in and help us vaccinate? Well, yes, if we're going to be getting 200,000 doses a week, but if we're going to get 100,000, then we're okay. So all of these factors kind of track back to this need to get a little bit more clarity and transparency on this ramp up. We heard yesterday that there's going to be a ramp up, and it's a very steep ramp up, and we're on the ramp, but
we're on a downward ramp right now, though, and that's the concern. When do you get your numbers? Is that something that you get for the next week? Are you getting those a week in advance, 2 weeks in advance, that you know when that 4510 is coming, say for this week?
So we get that. We get that. Now we get it 3 weeks in advance.
Okay.
We get it for 3 weeks, and then it's updated on a weekly basis.
Okay. All right. Thank you. We are here for you. So let us know specifically, I think to Member LaPlante's point, specific action items that you need from us so that we can support you.
Thank you.
Okay. Member Ozog, followed by Member Schwarzy, Krajewski, and Tornatore.
Thank you, Mr. Chairman. I'd like to make a couple points very quickly. My mother was a nurse epidemiologist and was working with some of the first AIDS patients in the early 80s. Effective treatments for AIDS took years. We have been able to have this vaccine developed in less than a year. That's a miracle. And I think the talking point that we need to use with our constituents is, first of all, just that fact. This was approved, I believe, 8 weeks ago for manufacture and distribution. 8 weeks. So obviously we have previous administration and I laud the development of the vaccine, but there really was no national rollout plan. Part of that is part of our state's, our system. There are many counties in this country that don't have a public health system. So the implementation of actually administering this vaccine nationwide is incredibly difficult and has had some major drawbacks. Then you have to think about how much production is available. I read recently that there is a county in Ontario, Canada, their allocation for the Pfizer vaccine comes from Europe, and yet they're about 400 miles away from the Pfizer plant in Kalamazoo. So the frustrations are universal. I have a cousin in Ireland who's a frontline nurse, and there's no vaccines happening there. So I think what we need to do is send the message, rather than comparing us to Cook County, that they're getting something we're not getting, or even using any reference to something like the Hunger Games, that this is a brand new process and that everybody is working as hard as they possibly can. And when the production has been increased, this is a simple economics 101 supply and demand problem. And I think we need to give as positive a response as we can to our constituents. And God willing, in 3 weeks, 4 weeks, we may have a completely different situation, as Karen referenced, vaccines raining from the sky. And we need to be patient, and we need to not add to this kind of mentality that where am I going to get mine? And we need to express patience and express that everyone is working as hard as they can. Thank you.
Okay, thank you for that insight. Member Schwarzy.
Thank you, Mr. Chairman, and thank you, Karen and Chris, for all your hard work. It feels like the phone calls I'm getting from residents is just not knowing. So, and I know that you are distributing by tier and then by chronological order of sign up, correct?
Yes.
So is there a way to, in the weekly updates that get emailed out to our residents, is there a way to indicate, okay, if you've signed up the week of January 7th, those are the people that have been vaccinated already, or just to allow residents, because I think most people really can be patient if they have an end in sight. And right now, I think the lack of patience is not having an end in sight on when they might it might be their turn. Is there anything we can do along those lines?
So I think there will be when we get a more routine and robust vaccine supply. I think what I know what put us back on our heels was going with a 75% drop in our allocation in a week's time that was completely unexpected. So if we had communicated with those individuals, we would have had to go back and say, oh, guess what, it's going to now take longer. I absolutely think that and hear your recommendation and believe that to be true, and we've heard that over and over, although I don't like to wait if I knew how long I have to wait, so I can kind of, you know, do I go somewhere next week, or will I get called for a vaccine and have to come back? Those kinds of practical matters I think are would be helpful. At this point, though, we don't have enough clarity or transparency to be able to do that.
Okay, thank you very much.
Thank you.
Member Krajewski, followed by Tornatore.
Yeah, thank you, Karen, again for your department and all the hard work. I'm going to pick up again on what Member Schwarzy said, and a couple other people have touched on it. Is just the people out there knowing when they're going to come up. Whether we have 2,000, we get 4,000, we get 6,000, we get 8,000 dosages, doesn't matter. It's where are they at? Because we've talked about we're giving them out to kind of the high-risk areas or certain clinics, but then it's how people signed up on the website. And then you've also referenced we're still doing 1A. So the question is, are we on the people that signed up January 7th? And, it's going to take a while if we only get 2,000 dosages. If we get 100,000, we'll be down to January 15th or January 18th. But that's the majority of the calls I'm getting is they just don't know. It's not a matter of how many doses, but where are they at in the line? Where are we at? It sounds like we're still doing 1A people. At least I think we're calling people that are 1A still.
Yes.
So 1B shouldn't even have got there unless the 1As don't want them. Then we move to the first people who signed up in 1B. But if we're giving them out to various clinics, are they using our list or are they using their own? And I still don't think I got a good handle on that answer to be able to relay it to the constituents. And as Member Schwarzy said, if somebody signed up January 7th, is that where we're at now? On the 7th, the people that signed up there? And it doesn't matter if we get 2,000, 4,000, it'll just take longer if you're February 1st, if we don't get a lot. If we get a lot, we'll get through the list quicker. But to be able to tell a resident where they're at in the list, then if you got more dosages, they move quicker. If we get 2,000 again, it's going to take longer. But I think getting that information to them will make their mind a lot easier.
We will absolutely work on that. Thank you.
Member Tornatore.
So you'll be able to get us a list that maybe residents can do that? Is that what I heard?
We'll work toward that. Again, it's the point, and I'll go back to the first question that was asked after the presentation was, can people sign up multiple times? Absolutely they can. Can they use the same email for multiple family members? Yes. And so it's not a simple one-to-one kind of thing. So what I will commit to you is that we will work to be able to provide that to you. I will provide an update the next time I come before you.
Thank you.
Yep.
We can't hear Member Tornatore.
Yes.
I haven't spoken
do you
yet.
Want to come?
This is Chris. I was just saying that in the email that goes out to people every week, we have added information in the past 2 weeks that says there are X number of people on the list. This week we've offered X number of appointments. This many people were vaccinated. So trying to give a better idea about what the pace has been, the week to week, what week are we exactly through is a little more tricky, but we'll share that information with you so you've got it, but it is going out to people that have signed up on that list.
Thank you, Mr. Chairman. And Karen, thank you. Chris, what you've done is incredible, and what you continue to do is incredible. And your advocacy and the advocacy of the chairman, I've been on most of those calls with IDPH, and the governor's office, and I can tell you that we have advocated for the citizens of this county, and it continues to be frustrating for me, and I do agree with Member Ozak. We need to be patient. That's the first thing that comes out of my mouth when I respond to multiple phone calls every day regarding why someone can't get a vaccine. And I, quite frankly, am not terribly concerned about what Cook County gets or doesn't get unless it affects my county. Now, just so everybody understands, the original theory here was that the local health departments were supposed to get the allocation from the state, and correct me if I'm wrong, Karen, and then the health department would distribute it to its partners for distribution to the citizens. The concern that I have, and where we've gone far afield, I think, are what I'd like to call these vaccine dumps. Jewel Osco gets 4,000 or 5,000. A particular school district gets a few thousand, or a municipality gets it, and suddenly twice as many doses that the county is getting goes to a particular area of the county, to those people, a specific group that are focused on that geographical area. So not only does that take away from the rest of the county, but it eliminates the health department's ability to spread those vaccines out to the people who need them the most throughout the county. And Karen has taken what seemingly has been hundreds of calls from me when I will say, how is X city or X school district getting all of these vaccines when we don't? And the answer is, they know somebody. Somebody makes a call to somebody who gets it, which is, I think, where the frustration comes in for me and the chairman and everybody else. We have 8% of the population, thereabouts, of the state. And Karen, what's the percentage of doses that we're getting right now compared to the entire dosage that the state is getting? Do we have that number?
Far less than 8%.
What? How much?
1.5%.
1.5. So 1.5 of the doses are coming to our county as opposed to what seemingly, if we were going to use per capita, which is what we've always talked about with CARES money and everything else, we should be getting 8%. We're getting 1.5. So the reality here is it's not really just a supply problem, and it's not economics 101. There's a supply problem. Everybody understands it. The problem for me is it's a distribution problem. I will acknowledge that the state isn't getting enough, and I think we all know that the country isn't getting enough. It's where is it going? And just tell us where it's going, and how do you rationalize 1.5% when we're supposed to get 8%? And how do you rationalize a particular municipality getting 4,000 or 5,000, which is twice the amount that the entire county is getting through the health department? We had to take the fairgrounds and shut it down for 3 days this week because we don't have the vaccines. We're only open Wednesday and Friday as opposed to 5 days a week. And yet, we've got over 100 partners, but we've got the recipients of, again, these vaccine dumps opening up their own areas and reinventing the wheel to make these distributions. It's craziness. It's chaos. And to those people who are on the Walgreens website, let me just let you know what happened to my brother who lives in Cook County. He got his first dose, and then he was supposed to get a second dose. He called the week before to verify that he was going to get a second dose, which is what they told him he would get. And they told him, no, you've got to go through the whole process all over again. Get on the computer and hit refresh until 3 in the morning because there was no guarantee for a second dose. So if you think you got the first dose, that automatically guarantees a second dose. The only place I think that guarantee applies is the DuPage County Health Department. And that's, again, where the frustration is. It's a supply problem. Nobody's suggesting that it's not. But it's a distribution problem. And if you're going to be patient and you're going to preach patience, then we have to be able to tell people where the vaccines are going. Because every day I read about other people getting vaccines not only in other parts of the county, but within our own county. And I'll call Karen and say, how did this town get 4,000 when we only got 2,400? And the answer is, I don't know. And it's not because Karen doesn't know what she's doing. We really don't know. So tell us where they're going. Let us know what's going on. It is a distribution problem, and I agree. Patience is what we have to do. And you know, again, I'm frustrated. The chairman's frustrated. We need to advocate on behalf of our residents, and we will continue to do that. But it's terribly important that we get the information that we request from IDPH. Thanks, Karen.
Thank you.
Okay, thank you. It does not appear that anyone else is seeking recognition for purposes of Q&A. So Karen, I don't know if you want to wrap it up, but again, thank you very much. I guess I would offer just this, if I may. Our health department, and I've shared this with the folks at the state level, you know, we know what we're doing. We're really good at it. We've been through crises in the past. We have a system. If you look at administrative rules and the law that sets up the whole public health delivery network in the state of Illinois, they should be standing shoulder to shoulder with Karen and every local health department director across the state, all 102. That's how public health is supposed to be distributed. It's supposed to be at the local level, where it's closest to the people, where we know the populations and the communities and the need. That's the way it's supposed to work. It's not supposed to be the top down. They're supposed to provide us support, but we're the ones that execute, that take initiative, that they follow our lead. And so it's been very difficult. I know everybody's trying their best. These are very stressful times. It's hard to tell somebody, be patient. Well, yeah, but my mother-in-law is 93 years old. She's got delicate health, and I just saw in the newspaper that a bunch of people got vaccinated in the next town over. Well, just be patient. You know, I can't do that. I'm sorry. I'm not supposed to just keep quiet and not shine a bright light on what's going on, because I think it's really disturbing and alarming and troubling. So with that, Karen, sorry.
So I would just say thank you so much. I hope to have a very different picture the next time I come before you and be able to share some good news. That would be very welcome at this point. But I think the good news is that we are getting vaccine out. Yes, not fast enough, but we are getting vaccine out, and we will continue until we're done. So thank you so much.
All right. Thank you, Karen. Oh, forgive me, Member Rutledge.
Thank you, Chairman. On that note, the information that we got this morning is great to put out to our constituents, but as far as what can we as county board members do to maybe rattle IDPH a little bit and get them to start allocating, what can we do?
Write a letter, talk to your state legislators, you know. I know that there's some of the legislators put together a distribution and a vaccination site in some of the Hispanic areas, and that's great. We could do that. We could be their partners. You know, we could have done that a while ago, you know, but so I would just say communicate with your legislators, communicate with the governor. Again, I think everyone's trying their best, but I think we have a really compelling story right now, and it's really very difficult for us to do our job without taking all sorts of unfair criticism because of things that we can't control. So in any event, thank you, Member Rutledge. I just, real quick, just to finish up Chairman's report, I have one quick note before we turn to our agenda. I want to take my hat off, even though I'm not wearing a hat, to the Public Works and Facilities staff who've done a marvelous job to improve the judicial office facility. It's a really an important period of time, a significant accomplishment. Next week, jury trials are set to resume, and our staff has done an outstanding job of upgrading the HVAC system over there, creating socially distant plexiglass courtrooms and basically making the Judicial Center a showplace for justice and public health.
Tim Harbaugh, Mark Thomas, Nick Kottmeyer. You guys are awesome. Thank you very much. I know Chief Judge Ken Popejoy is pleased and proud, and when he's happy, we're happy. This board made a significant commitment to ensure the safety of the public and the staff who utilize these courtrooms. I believe the investment will pay dividends for years to come. So congratulations to the staff, to the county board, to everybody who pulled together to make this happen. And finally, I'm going to turn over briefly to Assistant State's Attorney Connor McCarthy, who's got some remarks that he'd like to share. So I'm going to use my chairman's report within the rules to defer to Mr. McCarthy. Please proceed, Mr. McCarthy.
Thank you, Mr. Chairman. Shortly before the January 26, 2021 meeting, our office was asked to research the processes involved in a motion to postpone indefinitely. Our research takes the form of initial review of relevant law and statute. For the record, there is no statute or law governing a motion to postpone indefinitely. Following a review of the law, we conducted a research of the county board rules. We conducted a keyword search for indefinitely on the county board rules, which did not indicate any special processes to be used except where the motion to postpone indefinitely applies to motions to adjourn, lay on the table, or previous questions, and that rule only pertained to the precedence of the motion. Finally, our office reviews Robert's Rules, which provided that per Robert's Rules 11th edition, page 127, a motion to postpone indefinitely provides that debate may go fully into the main motion. Upon discussion with my colleagues prior to the January 26, 2021 meeting, our office was of the opinion that a motion to postpone indefinitely permits debate in the main motion based upon the information we located. On January 26, 2021, our advice was that per Robert's Rules 11th edition, a motion to postpone indefinitely provides that debate may go fully into the main motion. After the meeting on February 9th, 2021, Member Chaplin brought to my attention Section 9, Sub 1 of the County Board Rules, which provides that for all motions to postpone, including those indefinitely, though it does not reference motions to postpone indefinitely specifically, the motion shall not open the main question to debate. In light of this new information, my opinion on the matter would change to indicate that motions to postpone in any matter would not be open to the main motion to debate. That being said, a motion to postpone remains debatable on its own merits. My colleagues and I work very hard to provide the correct answers to your questions and inquiries. We use the best of our abilities to provide that information within the time frame necessary to answer your questions. On this occasion, our research did not locate, and therefore we overlooked a little-used county board rule germane to the parliamentary matter. So that's the clarification for the ruling and noting that the county board rules do cover that.
Okay, thank you for that acknowledgement and that clarification. That completes the chairman's report. We move on to the next order of business entitled Public Comment. Public comment, we have one person who is here in person. Mr. McCarthy, do we have, oh, I don't know who has this person here. So do we have any online comments? Oh, okay, there we are. Okay, well, let's go to the gentleman who's here in person. We have Stanley New, N-I-E-W, I think, Law Offices in Oak Brook, is here to provide testimony on subject matter 2-20-073. Please proceed, sir.
May it please the board. I represent Manuel Robles, who is the petitioner in Z20-073, which requests a conditional use only. What I'm asking this board is to recognize the reality of Route 83, where this petition is. The testimony at the Zoning Board of Appeals was clear and unequivocal that the properties to the north are all used, or virtually all are used as commercial properties. Then if you look directly behind the subject property is the Addison Industrial Park. And in there is a repair facility for the largest construction manufacturer. Now, Mr. Robles is in the construction industry. And what he has on his property are 4 vehicles. 8. 4 are trucks and 4 are construction type vehicles. What is important to note that his business is when those vehicles leave in the spring, when the construction season starts, They normally do not come back until the winter time, and they're merely parked there for the winter time. Now, Mr. Paul Haas, on behalf of the zoning board, had testified that the village of Addison tried to clean up the area some 4 years ago. Nothing's happened since that 4 years, and I'm not sure what cleanup they did 4 years ago. I asked this board to overrule the other committees and grant the conditional use. That concludes my comments.
Okay, thank you very much, sir. Thank you. Now we go to the commentary that was submitted via electronic means, and with that we have Dana. Please proceed.
Thank you, Chairman. First comment is from Bob Smith of Wheaton. Subject, veto bill. Comment, I commend the members of the board who've taken a stand for what's right for the residents of DuPage County. End of that comment. Next comment, Gerald Gentile. Policy breach is his subject. The Personnel Policy Manual is designed to act as a guideline for all employees, supervisors, and department heads in the day-to-day implementation of county board policies and to ensure uniformity throughout the county. Excuse me. Countywide elected officials may obtain their own independent personnel policies. As a valued employee of DuPage County, it is important that you are knowledgeable of the personnel policies that have been established by the county board. Please familiarize yourself with the policies and benefits included in this handbook and refer to it as a resource when you have questions. This is the language from the manual which I used as a resource this past year. I would like to state publicly that a breach in adherence to said policy may have occurred and implore the elected officials of this board to investigate. I trust the elected officials to uphold their oath and respond accordingly. Thank you. Stanley New submitted online, but I will defer to his in person. Last comment from Edgar Pale. Excuse me. Subject, Criminal Justice Reform Bill. I am perplexed as to why Members A has submitted a motion to reconsider the motion to table indefinitely Resolution CBR 014921. The County Board has already voted on this issue twice and is already clear where each of the members stand. There is no need to hold a third vote, as doing so would accomplish nothing more than what we have already seen in the two previous meetings. In any case, the governor has already signed the bill, so Members A's proposed motion is no longer relevant. I hope that the Republicans on the board will refrain from filing repetitive motions in the future, as it wastes the board's time and that of the public observing the meetings. Consider that the Democrats were in the minority party for much of the county's recent history, and they were much more graceful in accepting their losses during debate. I hope that the Republicans can act the same way and learn to move on from their defeat. That concludes public comment.
Okay, thank you very much. That concludes.
Oh, I'm sorry.
I just have a question. What's going on with public comment? How do we now have county staff reading public comment? I mean, it was the state's attorney's office. Now the clerk, I guess, the deputy clerk has refused. I mean, where are we at here with this? I don't understand the process and why we're making our staff do it. I mean, hell, I'll read them. I mean, this is ridiculous.
I have Vice Chairman Member Salmon, please.
Thank you, Chairman, and thank you, Members A, for the question. I agree that it has been confusing and a process we've all needed to work through. In the recent rules meeting, we discussed this in depth to try to come up with some clarification around this, because I very much agree with you that it seems to hop around with who reads it based on sometimes on subject matter. The idea that we're exploring, and we're still exploring this to see that the amount of time that we require of staff, is to have sort of a meeting enforcer role. So that wouldn't be an elected official. It would be a part of a staff member's job where they would be enforcing the rules of public comment. So reading them when they're submitted online, enforcing the timing issues, which we already have in our rules. And then they would also be, I'm hoping, take on that role of parliamentarian. So it would all live in one job responsibility. That hasn't been a final decision because we're still making sure that's not going to completely ruin someone's job and give them an extra 30 hours a week of work. But once we have that figured out, it is my intention to have a memo to the full board so everyone knows what the plan is going forward to limit the confusion.
But, Mr. Chairman, this is a committee that had an idea. Nothing's been voted on by the committee. Nothing's been voted on by this body. I don't understand what
I guess
the problems
maybe
are here.
I'll take responsibility as the presiding officer here. So as the committee debates these matters, we had the state's attorney reading public comment. Then there was some discussion about the appropriateness of that or inappropriateness of it, and then it was transferred to the deputy clerk. And so I guess I'm willing to be flexible to work through this process. It's been unusual in that we've been meeting like this during the pandemic. I think the large number of comments that have been submitted via email, electronically, has really, caused us, motivated us to really re-examine our rules and our processes here. So I guess it's a work in progress right now, Members A, and I thought Dana did a really fine job. It's a nice green folder there, and hopefully, I noticed it's not real thick, so it was okay. But no, your point is well taken, and not to minimize it in the least. I believe that we will get to a practice for public comment in short order. I know the Rules Committee has been examining this. I'm perfectly comfortable with being the enforcer, but I guess I haven't been tough enough. So I just think that when people come to speak, you kind of got to give them their day in court. But yes, we have a 3-minute rule, and we do try to ask people to abide by that. It doesn't really happen that often that people go past it, but whatever. I defer to those that are working on these rules, and the majority, the new majority, Mr. Pal, I'm happy to work with them. And so, yeah, we'll just it's a work in progress. We'll see where we go, but I think your point is well made. Thank you, Mr. Zay. Anyone else on the issue of public comment? No, I don't see anybody. So we move on to the next order of business entitled consent. Consent. Is there a motion?
So moved, DeCiani.
So moved by Member DeCiani.
Second by Chaplin.
By Member Chaplin. Mr. Clerk, please call the roll. DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski. Krajewski.
Aye, sorry, I'm trying to get my mute off.
All right. LaPlante.
Aye.
Ozog.
Aye.
Pachalski. Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
And Desart.
Aye.
Okay, thank you. We move on to the order of business entitled County Board. Member Ashley Selman.
Thank you, Mr. Chairman. I would move to combine items A, B, C, and D. These are appointments: 2 to the West Chicago Mosquito Abatement District, 1 to the West Chicago Fire Protection District, and 1 to as Weed Control Superintendent.
Second to combine, Desart.
Okay, there's a motion to combine these items. Mr. Clerk, please. There's a motion and a second. Mr. Clerk, please call the roll. Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachalski. Renahan.
Aye.
Rutledge.
Aye.
And Schwarzy.
Aye.
Okay, thanks, Mr. Clerk. These items are now combined. Please proceed, Member Selman.
Thank you, Mr. Chairman. I move on CVR 0160-21, the appointment of Donald Bowles to the West Chicago Mosquito Abatement District. CVR 161-21, the appointment of Kelly A. Madden to the West Chicago Mosquito Abatement District. CVR 162-21, appointment of Ruben Campos to the West Chicago Fire Protection District. And CVR 163-21, the appointment of Jennifer P. Heller as the Weed Control Superintendent.
Second Desart.
And a motion and a second. Mr. Clerk, please call the roll. Selman.
Aye.
Tornatori.
Aye.
Zay. Aye. Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart,
Aye.
DeCiani,
Aye.
Eckhoff, Garcia,
Aye.
Hart, Krajewski,
Aye.
LaPlante,
Aye.
Ozog,
Aye.
Kachowski, Renahan,
Aye.
Rutledge,
Aye.
and Shorzy.
Aye.
Thank you, Mr. Clerk. Member Selman?
Thank you. And lastly, I move on CB 15-21, an ordinance, the expansion of the Property Assessed Clean Energy PACE program in the County of DuPage, Illinois, providing for the option of a note structure over the existing structure.
Second, Zay.
Motion and second. Mr. Clerk, please call the roll.
Oh, discussion, Chairman.
Oh, I'm sorry. Forgive me. Who's seeking recognition? Member Selman?
Thank you, Mr. Chairman. We had a discussion on this in finance, and I'm going to be a no on this item, but I wanted to share the information that was shared with me in between the meetings. So I had asked if there was clarification as to whether or not there had been any defaults since this program began. They said that there has not been any, but the data for 2020 is obviously not available yet, so we don't know the effects of the pandemic on this program. As I reiterated before, and as I reiterated last year when I also voted no against this program, I don't feel it is the government's role to recruit private investors' dollars and possibly utilize the state's power to foreclose or otherwise claim over a property throughout this program. I think investing in clean energy is fantastic. I think providing a way for business owners to do that easily is also fantastic. If these were state dollars and not private investors' dollars, I would be an enthusiastic aye here. I just don't feel it's the role of our county government. Those are the end of my comments. Thank you, Mr. Chairman.
Very good, Member Selman. Member Chavez?
Thank you, Mr. Chairman. I just want to go a little bit deeper and just draw everyone's attention to, in our packet, page 237 under foreclosure, because it does say the property owner acknowledges and agrees that upon failure to pay any assessment payment, the county has the right to enforce the collection of delinquent asset payments, associated penalties, and all costs of the suit, including attorney's fees, by all legal means. And I just have to agree with Member Selman that I think the PACE program is a fantastic program. We want to get these programs into our county, and we want to encourage them. Everyone wants clean energy, but we just can't do it on the backs potentially of our residents, especially given the economic situation that we're currently in. We know we're going to be in recovery for a few years, and there may be some foreclosures coming, and I just don't think it's the role of the county. So for that reason, and for that reason only, I will be a no today.
Okay, thank you, Member Chavez. Member DeCiani?
Thank you, Mr. Chairman. I think this is a great program, and what we're doing is giving owners of properties the ability to finance through the property tax collection improvements to their properties. And I think if we don't have this clause in here, we're giving those folks the ability to walk away without any recourse, and actually putting more burden on taxpayers at the end of the day. So I don't understand why people would be against that disclosure and that ability to have some clawback, providing that person who decides to use this program doesn't files bankruptcy or whatever, doesn't decide to pay this back. We want to protect our taxpayers. I think that clause is important. I think it's a great program. We're giving people the ability to finance roofs, HVAC systems, and do this responsibly, keeping our carbon footprint as a county low and giving them a finance vehicle to do it, which is pretty unique and creative. So I think if we don't have that clawback or that clause in there, it really opens our taxpayers to liability that we don't want to expose on them. They're not the ones that are borrowing the money. It's these individual building owners that are doing this. So I think it's important we keep that in there, and we have we do have the program. It's a great program for small, mid-sized, and even large companies to take advantage. Thank you. I'll be voting yes.
Okie dokie. We have Member Selman seeking recognition. I don't see anyone else. Please proceed, Member Selman.
Just to clarify, we're not protecting taxpayers' interest when we would foreclose on this. We're protecting the interest and the financial security of private investors who have provided this capital. The only amount of money that comes to the county in this program is to cover our costs of administering it through the tax bill, which is appropriate. And I'm very happy we've done that. I remember the discussion last year. We did it really carefully to make sure we didn't lose dollars. But these aren't dollars that are going to a public good like schools or our park districts or our bodies of government. It's going to pay back private investors so that they can make a profit on their initial private investment. And that's I just want to make sure that was clear. Thank you, Mr. Chairman.
Oh, appreciate that clarity. Further discussion, Member Chaplin.
Yes, thank you, Mr. Chairman. I believe we have Mark Pikus with CPACE available for questions, or if he wanted to make some comments to give a little overview for the new members of the CPACE program.
Sure, why not? Mark, you want to come up here? Come on down.
I think he's on the...
So we're on, myself and Anna Maria Kowalik are on, and I was going to hand off this little review to Anna Maria.
Okay, wait a minute first. Can you identify yourself, your name and the organization that you represent?
Mark Pikus, Anna Maria Kowalik, the IECA, Illinois Energy Conservation Authority.
Yes, good morning, esteemed members of the DuPage County Board. My name is Anna Maria Kowalik, and I am also with the Illinois Energy Conservation Authority, or known as IECA PACE. Just as a little quick refresher for everyone, the IECA is a nonprofit program administration facilitator comprised of members, advisors, and consultants with deep ties to this region and 9 years of experience in CPACE across the country. Commercial property assessed clean energy, or CPACE, in simple terms is up to 100% financing of any energy efficient, renewable energy, water conservation, or resiliency components of any retrofit or new construction project. It's fixed rate, long-term financing with no personal guarantees and no out-of-pocket expense to the property owner. And there is no conventional product like it, except perhaps for a second mortgage, which would then limit one's credit facility and take it out. And the uniqueness of this project lies in the fact that it's underwritten on the property and the value of the property and not the property owner. So it's difficult to find any program more inherently equitable across the board than CPACE. It's equally effective in opportunity and enterprise zones as well as stabilized areas with for-profit corporations as well as nonprofit organizations with multifamily housing, 5 units and greater, including affordable housing. And in fact, HUD has approved CPACE and allows for a special process in financing their properties with a partner in CPACE. And so basically, PACE is presently enabled in 37 states across the nation with 24 active programs statewide, much like what IECA is doing together with DuPage County. Now, since its inception here in DuPage County in 2019, 3 deals have closed, 2 prior and 1 during the pandemic. The first was a flex industrial facility in Wooddale, and that was a warehouse office type facility that put on a new roof and solar PV system for about $318,000. The owner was able to amortize this over 25 years and was very happy with the outcome. The second was an office building in Elmhurst, right along North Avenue, just under $100,000 for a window retrofit project. Another extremely happy commercial property owner who not only was saving in electricity, but also in gas bills across the board. The third, which closed in late July 2020, was a pasta manufacturing facility in Bloomingdale. It too was another solar project for around $300,000. So to date, $718,000 approximately in CPACE financing has occurred in DuPage County. It's also worth noting that we currently have a deal in the pipeline, hopefully scheduled to close in the first quarter, which would allow for some $3 million in anticipated CPACE financing. So considering that this program nationwide is only about 9 to 10 years old, DuPage's program has grown according to all standards established across the country and is doing very well. And those are the ends of my comments. Thank you very much for the opportunity.
Okay, thank you. Anyone have any questions or Member Chaplin, that was your idea to have this woman speak, so that was nice. What do you want? So do you have anything further you want to add?
Member Tornatori asked if we could have an overview of the CPACE program for the new members, and so we got on the phone and we had them come in and give a little presentation. You know, as far as the environmental enhancements that we can make to, you know, corporate businesses in DuPage County, I think it's a great creative program for funding for these businesses to make these important environmental improvements. And we've seen, you know, in a short time, we've seen, I think she just mentioned 3 with a 4th coming on. So I think it's a real benefit to our businesses, economic development, and things of that nature. So I think it's a good program, and I'll be voting yes.
Okay, very good. So it doesn't appear to, Member DeCiani for another time. That's good. We like that. Please proceed.
Thank you, Mr. Chairman. I just want to mention that these normally businesses have the option of going to a private bank and borrowing money for a roof or a window replacement. Typically, banks will lend about up to 5 years at the max on this. So as you could hear, you know, roofs, 25-year amortizations. That's typically about how long a roof lasts. Those are great things to be able to offer as a lower payment and lower way to finance projects, getting people to do this as well. So again, traditional financing 5 years versus through this program 25 years and collected through your property taxes, which is a great vehicle. Again, we just want to make sure that lenders want to participate, and we have teeth to protect not only our lenders but also our taxpayers, because we will end up, if we don't have teeth, we will end up having to pay for these legal fees if there are foreclosures, et cetera, which if we don't have this protection would come out of our taxpayers' dollars. With these protections, we protect those taxpayers. The banks naturally want to participate in this program, especially if there's protections in there for them as well. So it's a win-win. It's a great program. And again, I wouldn't get too crazy on we're throwing, private businesses under the bus. They're the ones that are borrowing the money at great terms that they wouldn't be able to get if we did not have this program. We want to make sure we protect our county. Thank you.
Okay. Doesn't appear to be any further discussion. Has there been a motion on this item, CB 0015-21? Is there a motion and a second? Mr. Clerk, please call the roll.
Selman. No.
Tornatori. No. Zay.
Aye.
Chaplin.
Aye.
Chavez.
No.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
No.
Ozog.
No.
Pachowski. Renahan.
Aye.
Rutledge.
Aye.
And Schwarzy.
Aye.
12 voting aye, 6 voting nay. The resolution is adopted. Thank you, Member Selman. A fine report. On to the order of finance, Member Liz Chaplin.
Thank you, Chairman. By way of committee update, in technology this morning, they passed the Kinsey & Kinsey contract. And as you may know, this was a priority for Member Krajewski and myself. We had talked with various staff members and elected officials, and we discovered that our ERP system purchased in 2000 wasn't being used to its full capacity. So Kinsey is going to come in and they're going to do a functional assessment of the current financials, procurement, human resources, and payroll, and will provide information help in identifying what parts of the system were not implemented and what parts we haven't been using. So I think this is going to be a great benefit to the county. So to get our employees all using the system and making them more efficient in their work. So I'm really excited that that contract was passed and that we're going to be moving forward with that. So with that, I will move to approve FIR 015121, Resolution Acceptance and Appropriation of the Illinois Department of Commerce and Economic Opportunity Trade Adjustment Assistance Grant intergovernmental agreement for $400,833.
Okay, there's been a motion and a second. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge. Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin?
Thank you, Chairman.
Oh, I'm sorry. Oh, yes. Let the record reflect that Member Greg Hart is leaving the room. Please proceed, Member Chaplin.
Sorry, Mr. Chairman, can you show me leaving as well?
Let the record reflect that Member Ashley Selman is leaving the room or not participating in this. Please proceed, Member Chaplin.
Thank you, Chairman. I move approval of FIR 015721, acceptance and appropriation of the Giving DuPage staffing grant in the amount of $20,000.
Second, Garcia.
Been a motion and a second. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge. Schwarzy.
Aye.
Selman. Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin?
Thank you, Chairman. I move approval of FIR 015421, resolution revision to personnel headcount, addition of senior intake and referral specialist community services block grant.
Second.
Been a motion and a second. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge. Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Thank you, Mr. Clerk. Member Chaplin?
Thank you, Chairman. I move approval of FIR 016421, resolution placing names on payroll.
Second, Garcia.
Been a motion and a second. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan. Rutledge. Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Thank you, Mr. Clerk. Member Chaplin?
Thank you, Chairman. I move approval of FIR 016521, recommendation for the approval of a contract with Gas Depot to secure multi-state volume purchasing contracts for the period of April 1st, 2021 through March 31st, 2022.
Thank you. There's been a motion and a second by Member Rutledge. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski. LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge. Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin?
Thank you, Chairman. I move approval of FIR 016621, resolution recommendation for the approval of a payment to the DuPage County Health Department for reimbursement of COVID-eligible expenses from the CRF fund for a total amount of $2,095,423.43.
Second, Garcia.
Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin?
Thank you. Thank you, Chairman. I move approval of FIR 016721, ratification of emergency procurement of goods and services, total amount $167,500, COVID item.
There's been a motion and a second. Member Rutledge. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Thank you.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thanks, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move approval of FIR 016821, resolution recommendation for the approval of a payment to Wayne Township for the supplemental reimbursement of COVID-eligible expenses from the CRF fund for a total amount of $10,143.15.
Second Garcia.
Motion and a second. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move approval of FIR 016921, resolution budget transfer 22321, budget transfers of various companies and accounting units.
Thank you.
Second Rutledge.
Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thanks, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move approval of FIP 003921, recommendation for the approval of a contract purchase order to Casco International to provide employee service awards for milestone anniversaries. This contract covers June 1st, 2021 through May 31st, 2022 for a total amount not to exceed $52,830.
Second Garcia.
Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Tchotchkes.
Covert.
Aye. Sorry, I don't know if you can. Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge.
No.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. And Zay.
Aye.
Okay, thank you, Mr. Clerk. And for the final resolution, Member Chaplin.
Yes, thank you, Chairman. I move approval of FIO 001621, ordinance modification of the property tax year late tax penalties.
And a motion, is there a second?
Second.
Second by Garcia. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan. Rutledge. Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Thank you, Member Chaplin. A fine report. On to the order of development, Member Sam Tornatori.
Thank you, Mr. Chairman. Good morning. Move approval of DCO 0012-21, ordinance Z2073. Robles, this is to approve a rezoning from R4 Single Family Residential District to I2 General Industrial District, and 2 a conditional use for a planned development for parking, construction equipment, and trucks on the gravel portion of the property. This matter was denied at the ZBA 4-2. And was not approved at the County Development Committee 6-0. So a no vote would be consistent with those 2 committees.
Okay, there's been a motion. Is there a second?
Second.
Member Garcia.
Mr. Clerk, please call the roll.
Question?
Oh, I'm sorry. Forgive me. Member
Way
Garcia
over
with a
here.
question.
Yeah, I just wanted to make a comment on this motion. I did go out and look at this property, and the trucks are all parked there. I mean, so everything is in violation right now, and so I just want to make the board aware that they are totally in violation of what they were even asking here. And what they want to do is park it on gravel, which is totally against our code. So there's a lot of things that are working against us, so I will be of no vote on this. So.
Okay, good for you for going out there and checking it out. Been a motion and a second.
And just, Mr. Chairman, if I may, the purpose behind this application for rezoning is because they are in violation. And this would bring them back into compliance if there was rezoning.
Ah, that's good to know too. Very good. Motion and a second. Mr. Clerk, please call the roll.
Tornatori.
No.
Zay.
No.
Chaplin.
No.
Chavez.
No.
Covert.
No.
Desart.
Nay.
DeCiani.
No.
Eckhoff. Garcia.
No.
Hart. Krajewski.
No.
LaPlante.
Nay.
Ozog.
No.
Pachowski. Renahan. Rutledge.
No.
Schwarzy.
No.
And Selman.
No.
Thank you, Mr. Chairman.
Thank you, Mr. Tornatori. Thank you, Mr. Clerk. That resolution failed, is that correct? Yes, okay, thank you. We move on to the next order of business entitled Economic Development. Member Amy Chavez.
Thank you, Mr. Chairman. I move approval of EDR 0152-21, approval of issuance of payments by DuPage County to training providers through the Illinois Department of Commerce and Economic Opportunity Trade Adjustment grant in the amount of $227,218.
Second, DeCiani.
And a motion and a second. Mr. Clerk, please call the roll.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
And Chaplin.
Aye.
Thank you, Mr. Clerk. Member Chavez.
Thank you, Mr. Chairman. I move approval of resolution EDR 0156-21 for the DuPage Convention and Visitors Bureau designation of representation for grant purposes.
Second.
Is there a motion and a second? Mr. Clerk, please call the roll.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
And Chaplin.
Aye.
Okay, thank you. Thank you, Mr. Clerk. Thank you, Member Chavez. On to the Order of Health and Human Services, Member Renahan.
Thank you, Mr. Chairman. I move approval of HHS R155-21, a resolution of approval of a first modification for a CDBG agreement with Little City Foundation, a renovation of 2 Hanover Park CILA homes, project CD 20-03, revising the scope of work.
Second.
Second, Schwarzy.
And a motion and a second. Mr. Clerk, please call the roll.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay. Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart. Desart.
My apologies. Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
And Pachowski.
Thank you, Mr. Clerk. Member Renahan.
Thank you, Mr. Chairman. I move approval HHSP 33-21, a CDBG CARES Act item, contract purchase order with Catholic Charities Hope House to assist homeless residents with temporary housing, case management, budgeting, Job search assistance, transportation, job skills training, January 1st, 2021 through September 30th, 2022, not to exceed $175,000.
Second, Garcia.
Seconded by Member Garcia. Mr. Clerk, please call the roll.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
And Pachowski.
Thank you, Mr. Clerk. Member Renahan.
Thank you, Mr. Chairman. I move approval HHSP 35-21, approval of purchase order for Advocare Systems for rental of medical equipment bed for DuPage Care Center, March 1st, 2021 to February 28th, 2022, not to exceed $248,760 per lowest responsible bid. It's a care item.
Second, Rutledge.
Mr. Clerk, please call the roll.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante. Ozog.
Aye.
And Pachowski.
Thank you, Mr. Clerk. Member Renahan.
Thank you, Mr. Chairman. I move approval of HHSP 37-21. It is another CDBG CARES Act item. It is contract purchase order with DuPage Health Coalition to assist approximately 313 DuPage County residents who are not eligible for other programs with medical care, February 15, 2021 through September 30th, 2022, not to exceed $105,168.
Second to Sarge.
Mr. Clerk, please call the roll.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski. LaPlante.
Aye.
Ozog.
Aye.
And Pachowski.
Thank you, Mr. Clerk. Thank you, Member Renahan. On to Judicial Public Safety. Member Renahan.
One more item.
Oh, I'm sorry. Forgive me. One more.
Thank you, Mr. Chairman. We have an authorization for overnight travel, weatherization assessor to Champaign, April 19, 2021 to April 23, 2021 for $1,044.20. So it is grant funded.
There's been a motion.
Second, Garcia.
Mr. Clerk, please call the roll.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
And Pachowski.
Thank you, Mr. Clerk. Thank you, Member Renahan. On to Judicial Public Safety. Member Renahan.
Thank you, Mr. Chairman. Again, I'd like to invite the entire board to our March 2nd meeting at 1 p.m. We're going to be discussing the cost of implementation on the recently signed criminal justice bill. And with that, I will move approval of JPSP 34-21, approval of contract purchase order to Alliance Technology Group for upgrade of physical server and support maintenance, 3 years. For contract total not to exceed $57,534. It is the lowest bid renewal from the Sheriff's Office.
Second, Chaplin.
Mr. Clerk, please call the roll.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
And Pachowski.
Okay. Thank you, Mr. Clerk. Thank you, Member Renahan. On to the order of legislative. Member Desart.
Thank you, Chairman. By way of committee update, I'd just like to let you know that years ago, this board used to host a legislative breakfast. We haven't done that in a few years, but we're having our legislators in via Zoom during the meeting today at 2 o'clock, and you're all invited. we will be hearing from Senator John Curran and from State Rep Deb Conroy. So again, that's at 2 o'clock to join our legislative committee meeting today. And with that, I would like to make a motion to approve LEG R148-21, resolution adopting the county's 2021 federal legislative program.
Second, Chaplain.
Motion and a second. Mr. Clerk, please call the roll. I'm sorry, Member Zay. Darn it, you're right in front of me there. Sorry.
Yes, thank you, Mr. Chairman. You know, I was wondering if this could be sent back to committee. I know Member Selman had brought up something about enhanced security for government buildings. I didn't know this was going to be its own paragraph. This was just brought in. We didn't really discuss it. I'm just wondering, I mean, I can see under the first bullet point, provide COVID assistance to local governments, which we did. I mean, we spent tens of millions of dollars on the care center, 421, as we had talked about, jury trials are starting over at the judicial state's attorney's office. I don't understand what has happened in the last couple months. I mean, has there been a credible threat against the county that we need to somehow enhance our security at this point? I don't understand. It seems like when there was real social unrest and we had dump trucks in front of our entrances for a couple weeks, that there was an issue then, but I don't understand why we're asking for this specifically in its own paragraph. I mean, again, is there something I missed that we've been threatened or something? I would like to know before I came back to the meetings, you know, but I don't understand why this has its own standalone paragraph, that it just can't be just a line under, you know, provide COVID assistance to local governments.
Anyone? Anyone? Who? Member Selman and Member Ozog and Member.
No, never mind.
Are you seeking? No.
Thank you, Mr. Chairman. I just wanted to expand on why I had requested that be added, and I thank Member Dessart for adding it because I do think it's important. As we all know, on January 6th, there was an insurrection in our nation's capital where if things had gone wrong, every member of Congress, every member of the Senate, and our Vice President could have been murdered. Like many on this board, I've gotten messages that make me wonder if I'm safe. I've had things happen to personal property that make me wonder if I'm safe. I've increased security at my own home. I think at the very least, what we should do is make sure that we have a way to know that we're safe when we're in the building, and probably more importantly, that our staff are safe when they're in the building. I think some of the things we heard, you know, in the last few months too, is there's been these misinformation campaigns about the previous election. I know our clerk has expressed some real concern for her staff who are doing fantastic work. They're just doing their job, but if people are fed misinformation and are afraid, you can see how that could lead to danger. I am not aware of any specific threats of someone coming to this building and hoping to harm us, but I would like to make sure we're prepared if we ever get there. So my goal in including this in the federal legislation is that we can hopefully get the attention of our local representatives to get funding so we can meet those needs. So that's just the background for the board members. Thank you, Chairman.
Mr. Day, still seeking record. Okay, so
well, I just, again, I've heard there's no credible threat, and is this just kind of a knee-jerk reaction to something that happened? I mean, when we had looting going on in Naperville and Downers Grove and Elmhurst and Kenosha, and they were burning down, you know, a police headquarters in Minneapolis, we didn't seem to have any issues with this. Now all of a sudden there's a concern for our safety. We've been coming here a long time. I mean, is there something we should do? I mean, again, is there a study that's being done that says that we're not doing something? It seems like a knee-jerk reaction to something that happened in the Capitol. We all know that was a horrible thing, but I don't remember anybody organizing protests to walk on this building or anywhere in the courthouse or anywhere else. It just seems like a political move at this point, or theatrics, or whatever it is, when we really need money for, you know, things that we need. I mean, COVID relief, we need vaccines, we need everything else. I don't know if the security of this building, which I think is secure, it has been secure, and if we do need to secure it, we shouldn't be waiting for COVID money or money from the federal government. We should be doing it right away out of our money. So I just don't understand, again, why this is in here. And again, this really wasn't voted on in committee. It was a concept that was added here last minute. At least I would ask that it be sent back to, you know, to the committee for discussion.
Okay, further discussion. Member Selman was raising her hand and she wanted to respond. I think Member Chaplin here in the boardroom, followed by Member Ozog.
And just very briefly, Member Zay, you had asked if there was some data showing threats to counties. NACO did have a report on an increase in threats to county government. Cheryl, would you be able to share that with the board after this meeting, just so everyone can review it themselves? Or if someone sees Cheryl nodding, that's okay. I'm sure she's in there.
She's going to do that.
But there was a NACO study, so yes, you know, with all due respect, it's not a political stunt. I want to make sure that the building is safe for myself and for others. I know everyone here, we all sign up for this, but we have families, right? We want to make sure that we're able to operate safely. And right now, someone could walk in our building with a gun and probably not be stopped because we don't have the measures for that. So just making sure that we have the right security we need and that we can do it in the most cost-effective way possible. Thank you.
Member Chaplin.
Thank you, Chairman Cronin. I just wanted to mention when we were first elected in 2012, when we were seated on the board, I remember there were some board members that were concerned about safety with public coming over through this area and walking through, and we addressed their safety concerns and put up this half wall.
It's a nice wall, isn't it?
It is a nice wall. So, though I'm not a fan of walls, but anyways, so my point is, maybe sometimes it's better to be proactive than reactive. Maybe it's not a bad thing if we look at our security in the building, have some assessments done, you know, make sure everything that we are as safe as we could be. But I know that there were board members, like I said, early on that had concerns of our safety, and I mean, the remedy was the wall. So, you know, I don't think we should disregard people's concerns necessarily, and our clerk, I know, has had concerns as well. So, you know, we could, if you want to bring it back to the legislative committee, I don't have an issue with it, but, you know, we always address board members' concerns, so that's all I'm saying. Thank you.
Okay, thank you. Member Ozog, followed by Member Chavez. Member Ozog, were you seeking recognition?
Not right now, thank you.
Okay, forgive me. Member Chavez?
I'm concluded as well because Ashley brought attention to the NACO study, which I think is important because we have to be proactive when it comes to safety. We don't always know what we don't know, and I think that's what was proven with the attack on the nation's capital, is that there are conflicting reports of who knew what when, and I think we just need to be prepared because we may not know. So thank you.
Thank you. Member Renahan.
Thank you, Mr. Chairman. You know, just to kind of address kind of what is going on in the world. On January 27th of this year, a National Terrorism Advisory Bulletin was put out, and it was addressing domestic violent extremists in government buildings in particular. And I think that we need to just all note that as something. It does expire April 30th, 2021, but fact is there might be some money out there that can help us. If we can improve safety, let's certainly take a look at that without saying more. So I would be supportive.
We have Member Krajewski seeking recognition, followed by Member Rutledge.
Yeah, thank you, Chairman. I say that, I mean, we put that out and sent it to the federal government. It'll probably take a long time for reaction, but is somebody currently looking at this? Like, we got our sheriff looking at the campus and what can be done for enhancements? You know, as Member Zay mentioned, we had some issues going on back in May, and the sheriff was out with the dump trucks and blocking entrances, et cetera, because there was, you know, concern that people would be coming over there. But are we looking at it right now? I mean, I would say in addition to putting a paragraph in, we should probably at least have our sheriff, or maybe he is in the process, conduct a security, analysis of our campus. Thanks.
Okay, that's great. Thank you. So we have Nick Kottmeyer stepped up to the microphone to address those questions, Member Krajewski and others. Please proceed, Mr. Kottmeyer.
All very good questions. Just to give everybody an update, Member Renahan as chair of JPS, myself, Keith Briggs, we had Murray Snow there, head of OEM. We had a very, very good meeting. Oh, and Don Pachowski as well. I apologize. Don't want to forget you. Very good meeting talking about security overall. There's been obviously a lot of comments, a lot of questions over the past couple months, and we thought it was definitely time to sit down. I thought it was a very good meeting. I thought we covered a lot of issues. There is work moving forward, involvement of the sheriff, absolutely, involvement of comparison to other areas, and potential other steps that we will be bringing before either
Obviously, this committee, or this county board, finance committee, JPS, we got to figure out the path forward. Obviously, somewhat of sensitive nature, because if we're going to move forward, we want to make sure we do so in a thoughtful approach. But everybody's concerns have been well documented, and we are taking them seriously, trying to figure out a logical, thoughtful path forward. And all of the concerns we've heard from elected officials, we've definitely taken into consideration.
Nick, one thing, Nick, you mentioned that meeting you had and everything. Did the sheriff participate in that meeting?
The sheriff did not participate in that meeting, that initial meeting, but he's going.
Well, I would suggest we bring him in. I mean, he's the one that secured the county when we had the issues going on in May and set up the command center out Oak Brook Mall and coordinated all of it. I mean, I would definitely think we'd want him in the discussions on the security of this building.
He absolutely will be. And we've used, the sheriff and his staff have been phenomenal, because they've helped us, check our current assets, what we've had, some of our remote traffic courts. So absolutely, they're going to be part of the mix as we finalize what our plan is moving forward.
Member Desart.
Thank you, Chairman. I just wanted to say that that Member Zay is absolutely right. I mean, Member Selman brought this up in committee, and then Member Selman worked with Cheryl Marquet on the language, and we put it on there. It wasn't completely fleshed out, but I have not heard a motion to table from Member Zay. And so I would move forward with voting on this legislative agenda, just because I'm looking at, the committee is Selman, Chaplin, Renahan, LaPlante, myself, and Member Zay. It sounds like most of us are for looking into securing the campus.
Okay. I don't see that anyone else is seeking recognition. I'm sorry, Member Rutledge.
Thank you, Chair. Just a quick comment. I just want to point out that 2 days ago on 60 Minutes, they had a segment on judges, and particularly showcased a judge whose son was murdered and husband was gravely injured by disgruntled people. So I would definitely be in favor of asking these questions and being proactive. I'd hate to be in the spot of something terrible happening like that and having done nothing. So.
And if I'm a little bit evasive, it's kind of on purpose, and we talked about that in our meeting. I mean, obviously, from our standpoint, a lot is done here on campus, a lot for security that's unaware. I mean, we're happy to discuss that in executive and go through there, but everything that everybody's talking about, we are definitely taking seriously. I mean, that's what Keith lives and breathes, that, the sheriff, everybody. So what you're talking about, there are measures in place out there that aren't readily known.
Okay. So I think we've had a thorough examination of the issue. I know, oh my goodness, who else is seeking recognition?
Sorry, Member Chavez. I just want to see if we can add that to our next agenda for executive session. I think we all have an increased interest in knowing the protection levels of the county. And I think that, of course, we also need to make sure that our courts are protected. So if we could just get a brief overview of that, I think that would be wonderful.
I might suggest that maybe I'd like to have one more follow-up meeting with members Renahan and Pachowski, maybe, and just to close some loops that were raised in our initial meeting. And once we have that at their direction, I'd be happy to come for executive session at that point. But if we could maybe have a little bit more time so we could have a follow-up meeting from our original, I think we met maybe 2 weeks ago or something like that. Give us another week or so to meet, and then we'll come back to executive.
Thank you. Member Eckhoff seeking recognition.
I just want to talk about the fact that the public safety of this building did not just start the last few months because of what happened at the Capitol. Bill Babiar, when he was here, working over at OEM, did a lot to upgrade the status of this building. We changed our security group. There's other changes that were put in place that I don't think I want to talk about. But I would suggest before we start passing this, that all of you do what Nick said and take a tour of the building and find out what the status is. I have no problem seeking grants and things like that to enhance it even further, but I can guarantee you that when you talk about the courthouse, way back when, Judge Cresswell, that was her huge concern was court security, which is why we brought the arbitration center into the courthouse. That's why we brought 2 more field courts into the courthouse. And this building has been enhanced too, a lot more than just this wall. So we didn't start thinking about it just a couple months ago. So please, I don't think we want to have a public display of everything that we've done here, but I think it would behoove all of you to go on that tour with Chief Briggs and Nick and find out a little bit about that.
Yeah, I'm happy to do whatever this body would like.
Member Renahan?
Thank you, Mr. Chairman. Yeah, I just want to thank Member Eckhoff because he has done comprehensive study on this 2 years ago after the Aurora shooting. A lot of work was put into this building. And there's a lot of things that people probably don't know, especially our new members, but this is something that has been reviewed within the past 2 years. And so just so you're aware of that, this is not just coming out of the blue.
Okay, further discussion, Member Zay.
Yes, thank you, Mr. Chairman. I appreciate Chairman Dessart, the words that she said. I have no problem moving forward with this. I would just hope in the future. I know we had issues with the state legislative program with stormwater, and I didn't want to slow it down. I pulled it so it was removed from the state legislative, and then we brought it back to the committee and discussed it. So I appreciate her acknowledging this, but I don't want to hold it up. But again, I just think in the future that if somebody brings something up and the committee doesn't vote on it, it shouldn't be brought forward to the full county board for a full vote.
Okay, I think that concludes our discussion on this. If I may, security is a real issue. It's a real issue today, and it has been an issue in the past. You need to constantly reevaluate and reassess where you are. And I have talked to Member Selman. I've talked to Nick Kottmeyer. I'm delighted that Member Renahan and Pachowski have convened this group and focused on this issue. And I feel confident that we have a process in place that will do a thorough and appropriate examination, and we will come up with some recommendations and a path forward. I feel confident we're doing it the right way, and trying to take advantage of an opportunity to secure some money at the federal level is a good idea as well. So with that, Mr. Kottmeyer, do you have anything further to add? Yeah, I think we've kind of covered it pretty thoroughly. Thank you so much. Very good. So where are we? Member Renahan, on your judicial public safety report, did we already do that? Yes? Okay.
We're on to legislative, and there's been a motion and a second.
Oh, yeah, motion and a second on the legislative item LEGR 0148-21. Mr. Clerk, please call the roll.
Well, Mr. Chairman, I had...
Member Eckhoff.
Well, over the last 4 weeks, we had a resolution brought before us regarding the crime bill.
Oh, okay.
And we weren't allowed to vote on that over the last 2 weeks, or the last 4 weeks, and it was my understanding it was because some people thought we shouldn't make recommendations to the legislature or to the governor about how they should be passing bills and things like that. Now we've got a 9-page report. We're doing exactly that, seeming to contradict what had been passed by the majority over the last month. So I would make a motion to postpone this legislative draft indefinitely in order to give everyone the chance to be consistent in voting the way they did over the last month.
Really?
Really.
Okay.
I'm not understanding Member Eckhoff's point.
Okay. Let's move through this expeditiously. There's a motion here to postpone indefinitely the report and your committee recommendation LEGR 0148-21. There's a motion. I don't hear a second motion, so if there's not a second motion, we can. Okay. Well, thank you. We understand your sentiment, Member Eckhoff, and it will be duly noted for the record. All right. Well, thank you very much. And I am mindful of the fact that the governor did sign this bill. I've got issues with it, and I think you won't hear the end of it in the debate in the public square. But in any event, for our purposes here today, there's a motion and a second on this particular item. Mr. Clerk, please call the roll.
Dessart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
And Covert.
Aye.
Okay, thank you, Mr. Clerk. On to the order of Public Works, Member Ozog.
Thank you, Mr. Chairman. I would like to move for approval of FMP 003621, recommendation for the approval of a contract to Royal Pipe and Supply Company to furnish and deliver plumbing supplies for the period February 24th, 2021 through February 23rd, 2022, for a total contract amount not to exceed $148,007.50 per lowest responsible bid 20-133-FM.
On a motion, is there a second?
Second,
Member Garcia. Mr. Clerk, please call the roll.
Ozog.
Aye.
Pachowski. Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
And LaPlante.
Aye.
Okay, thank you, Mr. Clerk. Thank you, Member Ozog. On to the order of transportation, Member Pachowski.
Oh, we can't hear Member Pachowski, sorry.
I'll start again.
I think he's got to pull it closer. Yeah.
I'd move to approve DTR 14221, a resolution authorizing an intergovernmental agreement relating to the O'Hare Noise Compatibility Commission.
Second.
Been a motion and a second. Mr. Clerk, please call the roll.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge. Aye. Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
Chaplin. Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
And Ozog.
Aye.
Thank you, Mr. Clerk. Member Pachowski.
Thank you. Move to approve DTR 15021, a resolution for a local public agency agreement between the County of DuPage and Illinois Department of Transportation for improvements along Grand Avenue to County Line Road for an estimated cost of $1,620,471.
Second,
A motion
Garcia.
and seconded by Member Garcia. Mr. Clerk, please call the roll.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
I call her, she's not answering, and I text her for.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
And Ozog.
Aye.
Thanks, Mr. Clerk. Member Pachowski.
Thank you. Move to approve DTR 15821, a resolution to Copenhagen Construction, Inc. for the 2021 Sidewalk Improvement Program, an estimated cost of $215,459.91 per low bid.
Second. Renahan.
Mr. Clerk, please call the roll.
Pachowski.
Aye.
Renahan. Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay. Chaplin. Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
And Ozog.
Aye.
Thanks, Mr. Clerk.
Thank
Mr.
you. Move to
Pachowski.
approve DTR 15921, a impact fee credit agreement 21-01 to Bucks, Inc.
Mr. Clerk, please call the roll.
Pachowski.
Aye.
Renahan. Rutledge. Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay. Chaplin. Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
And Ozog.
Aye.
Thank you, Mr. Clerk.
Move to approve DTP 3821, a contract with Fleet Pride, Inc. to furnish and deliver heavy truck springs and brakes as needed to the Department of Transportation for an amount not to exceed $38,000.
Mr. Clerk, please call the roll.
Pachowski.
Aye.
Renahan. Rutledge. Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
Chaplin. Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
And Ozog.
Aye.
Thanks, Mr. Clerk.
Move to approve change order DTP 237-820, amendment to a resolution issued to K-Tech Specialty Coatings to furnish and deliver de-icing liquids as needed, increasing the amount $20,000, resulting in an amended contract of $83,900, an increase of 31.30%.
Mr. Clerk, please call the roll.
Pachowski.
Aye.
Renahan. Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
And Ozog.
Aye.
Okay, that concludes our committee reports. We move on to the next order of business entitled Discussion. We're all familiar with this. This is a piece of our business that we have to address according to state law. Public Act 990646, Pension Obligation Projections Required by Local Government Wage Increase Transparency Act. Anyone seeking recognition on this order of business? Seeing none, hearing none, I move on to the next item of business entitled Old Business. Old business. We have Member Rutledge seeking recognition.
Thank you, Chairman. I just wanted to clarify, I guess this, since we voted on it today, it's now old business. I wanted to talk about my no vote on the employee awards. I believe last year, or the last time this came up, I also voted no. In my own family over the last 10 years probably, I have placed a lot of emphasis on marking time with experiences rather than things. We all have too many things in our world, and sadly, as the chairman of the environmental committee, I see all of those things eventually going into our landfills, and I would just like to see, I know the employees like getting this, but I'd rather work up a menu of experiences that they could choose from for those 5 or 10 or 20, however many year milestones that we're celebrating. And I just want to reiterate that we have an amazing staff here in our county, and I am by no means trying to minimize that, but I think that, I just always say that as time goes on, we remember experiences much more than things. So that's all I have to say. Thank you.
Member Zay.
Yes, hey, it's on the agenda. Motion to reconsider the motion to table indefinitely, CBR 14921. I'm bringing that forward, Mr. Chairman.
There it is.
Contrary to our public comment, Mr. Pell, we really did not take a vote on this. We took a vote on a procedural maneuver. Those people we did not hear, a normally very chatty group that weighs in on every item that we have, was silent, except for Member Schwarzy. At least we had other government bodies in the county who had the political courage to move forward with this. I mean, I was taken aback today when Member Chaplin said we always address board members' concerns. Well, I guess not in this manner. When we're talking about something that happened at the Capitol about safety concerns, and we're talking about maybe we should look at something that NACO sent out, and when we had our state's attorney sitting here in the office saying this is going to affect the safety of our residents and our county, we sit silent on it. We did nothing. So I don't understand the double standard or the no consistency with the majority here, because again, this bill, it's not till we took the veto off, we took it that we're not in favor of it. And I'm just wondering, when I know Chairman Renahan keeps saying we're going to have this thing on the 2nd, when this comes up and the state's attorney and the public defender and the sheriff are going to say this is going to cost millions of dollars and we're going to have to add 10, 20, 30 head count to do what the state is asking us, what's our option at that point? Just take it at that point? I mean, is there going to be real considerations of how we're going to cut? Is our environmental program going to be gone? Is my stormwater program going to be gone? We're going to get rid of the water quality issues. I mean, how do we make up $4 or $5 million that this could cost us? And we'll find out the numbers for sure. But how are we going to do that? But again, we're talking about when Member Chaplin said we always address members' concerns. You don't think this crime bill has a concern for my family, my children living in this county and everywhere else? It does. So how are my concerns the last month different than what happened in the Capitol when this legislation has a direct effect on what's going to happen in the safety of our county and the cost it's going to be on this county?
Okay, just for clarification, everyone knows procedurally, Mr. Zay, Member Zay had voted on the prevailing side, and the rules permit someone who votes on the prevailing side to make a motion to reconsider. This motion to reconsider was the motion that Member Chaplin had moved to table indefinitely a resolution that I think called on the governor to veto this piece of legislation. No, forgive me. Yeah, please, yes, you explain. I'm just trying to give some context here, please.
The last motion was a resolution and objection.
Okay, forgive me.
Not a veto.
All right, I'm sorry. I stand corrected. Okay, so I see hands are up, so we're going to have a robust conversation about this, no doubt, but I just want to make sure that we frame this properly, right? So Mr. Zay is within his right and prerogative to make this motion. Is there a second on this motion? Seconded by Member Tornatore. Now, discussion. We have a number of people who've raised their hands. Member Ozog, we'll start with you.
I'd like to ask Mr. Zay a question. Last year, 6 of us signed a letter regarding women's reproductive health rights, and we did not expect the board to go along with that because we assumed that we would not have support. So has the members of the board who are interested in this motion, have you sent a letter to the governor? And let me also add, this is all a moot issue because he did sign the bill yesterday. You could have sent a letter yourselves. And I'm sorry, but this is, I can't help but feel that this is a political backing other members into a corner, and it's gone on for 3 different meetings. And I would not have expected support from you, and we wrote our own letter last year. So, it's good for the goose, good for the gander. I'm sorry.
Okay, using Mr. Zay's name in your discussion, please, Mr. Zay.
Member Ozog, I was not aware of you writing any letter or bringing anything about reproductive, whatever you had said before this board. I don't know if it was brought forward.
We didn't.
Well, you
did
didn't.
You send a letter to the? Did you send a letter to the governor yourselves?
Okay, well, that's great. Was it an ongoing bill that the state had passed in the veto session?
I'm not going to compare the issues, but I'm just going to say to you that this has gone on for 3 different meetings, and you got the answer 3 different times, which was we weren't taking it up.
Your issue, I don't think, has anything to do with the current issue that's going on.
Did you send a letter? Did the members who called for this send a letter to the governor yourselves?
Okay, so further discussion, I noticed a couple other hands. I think Member Selman, please.
Oh, I had another item on old business. After we're done here, I'll comment on that.
Anyone else seeking recognition on this issue that's before us right now?
No, nobody.
Okay, I don't see anyone else. All right, so there is a motion by Member Zay and seconded by Member Tornatore, and it's to reconsider that motion to table the resolution which discusses an objection to this legislation, not seeking or asking a veto of it. So seeing no further discussion, there's been a motion and a second. Mr. Clerk, please call the roll.
Zay.
Aye.
Chaplin.
No.
Chavez.
No.
Covert.
No.
Desart.
Nay.
DeCiani.
Aye.
Eckhoff. Garcia.
No.
Hart. Krajewski.
Aye.
LaPlante.
Nay.
Ozog.
No.
Pachalski. Renahan.
No.
Rutledge.
No.
Schwarzy. Schwarzy?
I can read his lips.
No. Sorry.
Selman?
No.
And Tornatore?
We have 6 voting aye or 7? 7 voting aye, 11 voting nay. The motion fails. Thank you, Mr. Zay. Is there anyone else seeking recognition? I remember Member Selman on a matter of old business. Please proceed.
Thank you, Mr. Chairman. To follow up a little bit on Member Pacholski's question earlier about Bensonville, I know you all got this article in your sort of news clips, but I really want to draw your attention to it because I think it's something we can all be proud of. The Daily Herald had an article on the 17th highlighting Bensonville's COVID-19 attention to their Hispanic residents. So by way of reminder for the new members, we allocated $80,000 of CARES Act dollars to hire an individual who could act as a liaison to the Hispanic community in Bensonville to learn not only why the rates were so high, but also help address some of these issues. In this article, which I hope everyone goes back and finds because it's really inspiring, 2 things I wanted to take away and make sure everyone noted is at the time when they first opened their Hispanic Latino population outreach, residents in DuPage County of Hispanic descent were 3.8 times more likely to contract COVID than non-Hispanic or Latino residents. Currently in Bensonville, they've got that down to 2.3 times. So such incredible progress. They also highlighted the other ways in which they're helping the outreach volunteers working with residents who are able to express when they have unsafe work conditions or need testing. And so they're still helping with those basic items. And there's one thing, at the end of the article, the woman who does this program was saying that she was trying to learn about hesitancy or why the rates were so high. And she expressed that she felt that many of our immigrant neighbors who've had a hard time or a hard journey to get here have thought the worst has happened to them. They've already survived that, so nothing could probably be worse. And I just hope we all maybe remember that as we're hearing from our residents. We're so impatient, and that we just remember it's been a hard year for everyone. And I just hope that we can all feel really proud that those $80,000 we spent in Bensonville are saving lives and helping people be safe at their jobs. So thank you to everyone on the board who helped there.
Very nice. Member Covert, followed by Member Ozog, followed by Member Desart.
Thank you, Mr. Chairman. I just wanted to comment on my vote on the motion to reconsider by Member Zay. I just wanted to clarify that the bill was signed yesterday, and so today it's a moot point, and that's why I voted no. But I do wish that I voted yes before to talk about it on the floor. I wish there had been a little bit more discussion, and the people who felt a certain way about it should have voted it for the record. I was willing to, and I don't think there's anything wrong with that in just placing a vote on the record on where you stand. And that's what I wanted to do. But I never agreed with postponing an issue. I wanted to talk about it and see where everybody stands. So everybody has a clear picture in our county as to where we do stand. So anyways, that's all I wanted to say, that it's just a moot point at this juncture because the bill was signed yesterday, and I wanted to clarify that. Thank you.
Thank you, Member Covert. Member Ozog.
Thank you, Mr. Chairman. Earlier today, we approved $2,095,000 in COVID money for our DuPage County Health Department, and we had a presentation from Karen Ayala and discussed vaccinations. I wanted to just say today that I'm disappointed to see that several of my colleagues in the boardroom removing their masks to speak, sitting in the boardroom without masks and with masks pulled down. I respectfully ask that everybody in the boardroom please keep your masks on at all times. We have many months until we reach optimal vaccination levels, as we've heard today. And until then, masks are one of our best defenses against the COVID virus. We need to be good examples and better examples to our constituents. Thank you.
I am touched by your concern for me. I have a certain level of immunity right now. I'm socially distanced. I've been very careful, but thank you, Member Ozog. I appreciate your concern.
The governor's mandate is to wear masks inside. Thank you.
Thank you. Member Desart, and followed by Member Chaplin.
Thank you, Chairman. I'd like to discuss regarding number 7 consent items. Letter B, approval of committee minutes. I've been in conversation with Nick Kottmeyer about this item. First, the committee meeting minutes are not in our board packet. They're not physically in our board packet, so I'm uncomfortable actually voting to approve something that I haven't seen or read. Secondly, today's board packet is already 713 pages, so I can't see any of us wanting to add pages to our board packet. Also, even if all the committee minutes were in the board packet, I wouldn't necessarily feel more comfortable voting to approve minutes for meetings that I have not attended. For example, if I'm not on that committee, I wouldn't know if the minutes were accurate. So on page 29 of our board rules, E, consent agenda, 3A, it says the consent agenda may include the following, not must include the following, only may, and that includes minutes of all county board and standing committees. So as committee minutes are voted on and approved at each committee themselves, I'm wondering if this board would mind taking off our agenda the approval of committee minutes, since that is allowed within our board rules. Does anybody have a problem with, under the consent agenda, taking out the approval of committee meeting minutes? Can I just see a show of hands of anybody who agrees with me that they shouldn't be there?
Could I make a comment?
Yeah, we have
Could I make
Member
a comment?
Chaplin seeking recognition on this matter for purposes of discussion,
Yeah.
as is Member Zay.
Thanks so much, Member Dessart. I think that's a great comment and great commentary. Right now, I don't know if I'm ready to make that decision right now, but I think we should refer it to the Rules Committee and then discuss taking that off the agenda at the time of the Rules Committee, because maybe there's some, I don't know if there's some statutorial thing that we have to have minutes approved, you know.
There is not, according to Nick Hotmeyer, there is not.
Okay.
Member Dessart is absolutely correct in how she phrased it. It does not have to be in there. It's just historically it's been in there. And as she actually brought up, it took us a little bit of research to figure it out. We don't actually put the actual minutes that are approved by committees in your packet. There's simply a vote to approve it in consent where it's been approved in committees already. And so you would have to go back to committees to figure it out. It's never, we check back to, I think, 2014. It's always been done this way. And you have every ability by the county board rules. We checked with the state's attorney. You can take it out. You can keep it how it is. We can add minutes in there, which I'd prefer not that one. Our packets are pretty long to begin with. But yes, you have every ability to take it out if you want to.
Oh, great. All right, then that is the question.
It actually suggests that we do take it out because it's actually not good for us to be voting on stuff we haven't seen for those meetings we didn't attend. I mean, how would I vote on, for example, I have attended developments often, but not this past development meeting. Why should I then have to vote on the development committee meeting minutes? They're not in the packet. I didn't attend the meeting. How can I rightfully vote to approve those minutes?
Yeah, as long as I heard from Mick, I don't have an issue with it. Thank you.
Okay. So is there a motion to take that part of the report out of the resolution? Is that?
Yeah, I'll make the motion. Sure, okay. Chairman. Make a motion to take that part of the report out of the consent item.
Okay, Mr. Zay, do you want to offer some guidance here with your years of experience and wisdom?
I just don't want to go to jail. It's not on the agenda, so we can't vote on it. So that's a violation of Open Meetings Act.
And that's, it's definitely not on there, but you don't need a motion if there's a show of hands because it's not required by the county board rules. You're simply giving staff direction to make a change. There's no need to take a vote up or down.
Nope.
I just didn't want to make this change without general consensus.
Okay, so I think there's a general consensus here to go ahead and make that change. Seems like to me. Okay, yeah.
Thanks, Nick.
Thank you, Member Dessart. Any other discussion? Where are we? On old business? Yes,
Yeah.
Member Chaplin.
Yes, thank you, Member Dessart. You just shortened our agenda a little bit. So kind of piggybacking off of what Member Summer was talking about, our CARES funding and what great things we've been able to do with that CARES money. On February 11th, I was able to join Congressman Caston. I know you couldn't make it, and local mayors and Lake County Chair Sandy Hart to discuss.
She's good, isn't she, Sandy Hart?
Yes,
Yeah.
everybody was very nice on the panel to discuss the importance of the CARES funding, and I was able to give some examples of what we did with the CARES funding. I was also able to thank Congressman Caston for his efforts in securing the $161 million for us. And I was able to talk about what we would do with additional CARES funding and how important it is for the county to receive additional federal money. So it was a great opportunity. It was a good conversation, and I was happy to do that on behalf of the board. So
I heard you did a great job. Any other discussion on the order of old business? Old. Can we move on to the next order of business entitled new business? New business. Anyone seeking recognition on the order of new business? Looking forward. Mr. Zay.
Yes, thank you, Mr. Chairman. You know, we heard from our Assistant State's Attorney McCarthy before the meeting, and I know our staff goes a long way here at the county to do work. And at one of the committee meetings, there was some comments made about his performance, that it was horrible and this and that. And I'm going to tell you, I think Connor does an outstanding job here at the county. He's got a lot of responsibilities. They give us the best of their legal opinion. I'm not an attorney. I appreciate his input. I know he gives it to us unbiased and by the law, and anybody who would make a comment like that, I just think is uncalled for with our staff here. And, you know, I just want him to know that I appreciate all the work he does. They do a lot here. He's done a lot for many, many years. And again, they're there for advice and consent. If anybody disagrees with what our state's attorney says, they should stand up and say it. And then, you know, we talk about bringing other people in to read public comment and to be a parliamentarian. Why don't we police ourselves? Why don't we take that responsibility on ourselves and do it instead of trying to pass it off to somebody else? So again, Connor, I think you do a great job here at the county and appreciate everything you do on behalf of the citizens.
Thank you. Thank you, Mr. Zay. I agree with you. Thank you, Mr. McCarthy, for the good work that you do. Further discussion on the order of new business? Anyone seeking recognition on the order of new business? New business. Okay. Member Covert, there she is.
Thank you, Mr. Chair. I just want to add, I just want to thank Connor as well. Whenever I have a question, he's there to answer it right away. He's very professional and very knowledgeable. So, Connor, thank you again for everything that you do.
Very nice. Thank you. Very nice. So, I don't think there's anyone else seeking recognition on the order of new business. Our next order of business is executive session. And we do, in fact, have a matter to discuss. I see our state's attorney is here with us. Right, okay. So pursuant to Open Meetings Act 5 ILCS 120/2C11 regarding pending litigation, I will entertain a motion for us to gather and organize ourselves in executive session. So moved by Member Pachowski, seconded by Member Chaplin. Mr. Clerk, please call the roll.
Pachowski. Aye. Renahan. Aye. Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Aye. Zay.
Aye.
Chaplin.
Aye.
Chavez. Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff.
Thanks.
Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
And Ozog.
Aye.
Okay, we have taken a vote. We will organize ourselves in executive session. We can take a quick break to, collect ourselves and organize and. Okay, I've gotten the move ahead signal from our crack tech team, so we're back onto the regular agenda with the regular recording devices that are available to the public. So at this point, I will entertain a motion to adjourn this meeting to Tuesday, March 9th at 10 a.m.
So move DeCiani.
Second, Chaplin.
There's been a motion by Mr. DeCiani, seconded by Member Chaplin. Member Desart, you seeking recognition? No?
No.
Okay. Mr. Clerk, please call the roll on the adjournment motion.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart. Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski. Renahan.
Renahan.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay. Chaplin. Chavez.
Aye.
Covert.
Aye.
And Desart.
Greg?
Aye.
Can I take a minute of your time before you
Okay, this meeting is adjourned. Thank you.